Roll.
Trustee Fenton.
Here.
Trustee Dodge.
Here.
Trustee Calandrello.
Here.
Trustee Healy.
Here.
Trustee Katsinas.
Here.
Trustee Malani.
Here.
Mayor Pico.
Here.
Approval of May 4, 2020 regular meeting minutes.
Mr. Chairman, doing the pledge.
Trustee Malani.
I move to approve the minutes of the Board of Trustees meeting of May 4th, 2020.
Second.
Any comments? Call the roll.
Trustee Malani.
Aye.
Trustee Calandrello.
Aye.
Trustee Fenton.
Abstain.
Trustee Dodge.
Aye.
Trustee Healy.
Aye.
Trustee Katsinas.
Aye.
Mayor Pico.
Aye.
Accounts payable from May 5th, 2020 to May 18th, 2020.
I'll entertain a motion to approve the accounts payable from May 5th, 2020 to May 18th, 2020 in the amount of $3,372,012.02.
So moved.
Second. Call the roll.
Trustee Dodge.
Aye.
Trustee Healy.
Aye.
Trustee Fenton.
Aye.
Trustee Calandrello.
Aye.
Trustee Katsinas.
Aye.
Trustee Malani.
Aye.
Mayor Pico.
Aye.
Payroll from May 15th, 2020.
Do we have a consent agenda?
Oh, I'm sorry, it's consent agenda.
Consent agenda. Item A, payroll for May 15th, 2020. Item B, approval of Illinois Workers' Compensation Commission settlement contract lump sum petition in order in case numbers 19 WC 12810 and 20 WC 06762. Item C, Autumn Recreation and Parks Program lists approval. Item D, Camino Park Pond Shoreline Restoration Stewardship 2020 to 2023. Item E, Eagle Ridge 4 Pond Shoreline Restoration Stewardship 2020 to 2023. Item F, Parkview Estates Pond Shoreline Restoration Stewardship 2020 to 2023. Item G, Redondo Pond Shoreline Restoration Stewardship 2020 to 2023. Item H, Rec Center and Rec Center South Pond Shoreline Restoration Stewardship 2020 to 2023. Item I, Warwick Lane and Warwick Lane South, North and Warwick Lane South Ponds Shoreline Restoration Stewardship 2020 to 2023. Item J, Park Courts Repairs Bid Award. Item K, a resolution authorizing the renewal and execution of an intergovernmental agreement with the Village of Orland Hills, providing for police dispatching and prisoner detention services resolution. Item L, parcel OME 0011 conveyance to IDOT, Illinois Route 7 Southwest Highway Project resolution. Item M, parcel OME 0017 conveyance to IDOT, Illinois Route 7 Southwest Highway Project resolution. Item N, Bilex subdivision, formerly Phase 6A of Palos West, plat of subdivision approval for water and sewer service for unincorporated property. Item O, disposal of village equipment, online auction, Public Works Department ordinance. Item P, Sterling Ridge Park Development Award. I'll entertain a motion to approve items A through P of the consent agenda.
So moved.
Second. Call the roll.
Who moved that? Who made the motion?
John, I did. Dodge.
Dodge and Healy seconded it.
Thank you. Trustee Dodge.
Aye.
Trustee Healy.
Aye.
Trustee Fenton.
Aye.
Trustee Calandrello.
Aye.
Trustee Katsinas.
Aye.
Trustee Malani.
Aye.
Mayor Pico.
Aye.
Resolution approving mental health collaboration program, subaward, subrecipient agreements, Village of Orland Park, Trinity Services Incorporated, Ann Wegerson, Christopher Keys, Martina Mihalikova.
Mr. Chairman,
Trustee Malani.
resolution number, please.
2021.
I move to pass Resolution 2021 entitled Resolution Approving Mental Health Collaboration Program Subaward/Subrecipient Agreements, Village of Orland Park, Trinity Services Incorporated, Annie Wegzrin, M.A., Christopher Keys, Ph.D., and Martina Mihalikova, M.A., and move to authorize the village manager or his designee to execute the agreement upon approval of the board.
Second.
Any questions or comments?
Mr. Mayor,
Trustee Katsinas.
could we have the police chief just give us a little information on this, if you would, please.
Mr. Mayor, members of the board, this is a resolution to approve us obtaining a $750,000 grant from the Department of Justice, which it's a 3-year grant. It will allow us to work with Trinity Services, who we now use for assistance on our mental health calls. So we will be tracking in a very accurately our calls for service for those who are suffering from mental illness. It will allow our officers to actually leave the call, and Trinity Services will have an office open here in Orland Park, and assume there's no safety issue, they'll take over the call altogether. Now, they're going to provide us with tablets and other electronics so we can document every call that we have so that there's accurate data. This will not only be for calls which may be people suffering from mental illness, but also from substance abuse. It's also going to emphasize these issues with women in particular to track it from a female standpoint. This will be an Orland Park only grant in operation for the first year, but after that it will spread to approximately 7 or 8 surrounding suburbs to implement the same program. So we see it as while our CIT officers are trained to detect mental illness, we are not experts. We don't pretend that we're experts, but we have the training to be able to at least detect it. But in this case, we'll have professionals on the scene. What we always try to do is, if the person needs to be hospitalized, to try to make it a voluntary committal, because we know the results are always better on a voluntary committal versus involuntary. Having trained professionals there, we'll take that little bit stigma away of a uniformed police officer coming to your home at 3 o'clock in the morning. Somewhat intimidating, and sometimes it creates more stress than it need be when we can be there for only a short period of time, turn it over to a professional. If they need to be transported normally by fire department ambulance with a trained professional with them. So we have one of the finest CIT programs anywhere. We've been recognized by SAMHSA for having one of the best programs in the country, and we were brought to Washington, D.C. 2 years ago to highlight our program. So this is just a continuation of that program, and it's the attempt also is to divert these cases from arrest. In some cases, there's no alternative. There simply isn't. Serious crime has been committed, but in many other cases, it's a minor event where someone is acting out in public and someone calls. Rather than an arrest take place, we bring the professionals. So this is a $750,000 grant, one of the largest the police department has ever received, and I think most importantly recognizes the professionalism of our CIT program and our officers. And I think it'll be, we hope it'll be hugely successful. We hope it'll be of great benefit to our residents, of those who have loved ones who might be suffering from mental illness or even substance abuse. So we're really pleased to partner with Trinity Services and other professionals in this endeavor for Orland Park alone for the first year, and then to bring in the other departments after that. So I think it'd be a great use of our resources and be a great help to the residents of Orland Park. Any
Thanks,
questions?
Chief.
Chief, wouldn't you say the call volumes for the type of services they're going to offer has increased in recent years?
Yes, it has. It has for any number of reasons. Alcohol and drug abuse, in our view, has not lessened, and very often these type of issues are aggravated by alcohol and drug abuse. But I think we've also found that there is an awful lot of people suffering from mental illness that have never been treated or never even been called upon. And one of the programs that we've seemed to get an awful lot of accolades for is CIT, and how our officers handle it since we implemented this about 5 years ago. So I think this is only and hopefully just going to make this program better and provide a really great service for the residents of Orland Park.
Excellent. Thank you, Chief.
Anything
Mr.
else?
Chairman.
Thank you.
Any other comments?
Mr. Chairman.
Trustee Malani?
Chief McCarthy, another kind of to piggyback on what Trustee Katsianis was just saying. Have we seen an uptick in the number of incidents over the last few months since March?
Yes. Did not start that way for the first 4 or 5 weeks, but since then we have seen a significant increase in number of domestic cases, which do include mental illness, do include alcohol and drug abuse. So yes, there has been an increase.
Thank you.
Anything else? The other thing I'll add is, yeah, this is an outstanding program. It's going to be needed more than ever, given the current crisis, as Trustee Malani just pointed out and asked, with the economic destruction that's going with it. I actually looked this up. A study of the Great Recession showed that for every percentage point of unemployment increase, the suicide rate goes up 1.6%. So just over the last 2 months, we have an increase in unemployment of 18%. If that study holds true, which I hope it doesn't, that's a 30% increase in suicide attempts and suicides. So that doesn't even include the other mental health issues you talked about. So I'm really thankful we have this program. I think it's going to be, it's been a great program, and it's going to be needed more than ever. So thanks, Chief. Call the roll.
Trustee Malani?
Aye.
Trustee Katsinas?
Aye.
Trustee Fenton?
Aye.
Trustee Dodge?
Aye.
Trustee Calendaro?
Aye.
Trustee Healy?
Aye.
Mayor Pico?
Aye.
Rebuild Illinois, additional neighborhood road resurfacing.
Mr. Chairman,
Trustee Malani.
I move to recommend proceeding forward with additional 2020 road resurfacing via the Rebuild Illinois Bond Fund process.
Second.
Any questions or comments?
Mr. Chairman,
Trustee Malani.
given the situation our state's in today, I think it's refreshing to hear that IDOT is continuing with this program and that we'll actually be receiving these funds, because an additional $3.7 million is something that'll definitely help us get caught up with our road programs, our planning, and actually a reduction of the village expenditures along the way. So I'm really glad to see this going through.
Any other comments? So this is a good program. It's important. We can spend it on a lot of different things road related, but it's important that even in these times that we continue our capital programs, delaying capital programs. Things like keeping our roads repaired only end up costing us more money in the long run. So I want to thank the board for expanding the road program last year, then continuing that investment this year. We've advanced our road program several years with the decisions we've made in the last 12 months. And a few more years of these efforts, including this, will help us remain on a normal schedule going forward. So thank you for everyone for doing that. Call the roll.
Trustee Malani?
Aye.
Trustee Dodge?
Aye.
Trustee Fenton? Trustee Calendaro?
Aye.
Trustee Healy?
Aye.
Trustee Katsinas?
Aye.
Mayor Pico?
Aye.
An ordinance amending Title VII of the Orland Park Village Code to provide support to restaurants in Orland Park during the COVID-19 pandemic.
Mr. Chairman,
Trustee Healy.
could I have an ordinance number, John?
5513.
I move to pass ordinance number 5513, entitled "An Ordinance Amending Title VII, Business and License of the Orland Park Village Code to provide support to restaurants in Orland Park during the COVID-19 pandemic."
Second.
And George, could you just give everyone a brief overview of what this is, or have someone do it?
So this is another attempt to assist businesses once the pandemic actually ceases. Restaurants, when they do get to reopen for dine-in seating, will undoubtedly be at limited capacity. So if their inside capacity is limited, they're going to have additional parking in their parking lot. So what we're going to, with this program, the additional parking that's in the parking lot, we would make that outdoor seating. It's a permit process. It's a very simple one-page permit process that they would submit. We would turn it around very quickly. We would and then allow them for the next 90 days, if the board wants to extend it, to have the ability to have outdoor dining, and that also includes liquor sales and consumption. So it's basically what we would be doing is just expanding the footprint of where they would have their restaurant. It's something that's being done in the states that have already started opening, and it's successful. It's going to also help. There's going to be a period where people are not going to feel like they're going to want to go inside of a building like a restaurant. So this will be just another thing for businesses to be able to enhance their business.
Any other questions or comments?
Mr. Mayor?
Trustee Katsinas.
George, will there be a charge for this license for a business to apply for the license to fill out the form?
No.
So it's at no charge to the business?
Correct.
Thank you.
Mr. Mayor,
Trustee Calandrello.
just wanted to thank staff for bringing this up. I think this is a great thing, and it's supported by science. That transmission outside is almost, it's very, the resistance, or the percentage of outside transmission has been very, very low. So I think it's just a great way to help our small businesses and our businesses, period. So the science supports this, and we try to support our business as much as we can. So thank you for bringing that up, and hopefully it's a smooth transition.
Mr. Mayor?
Trustee Healy.
I think this is a great idea, George. I think I'm glad we're doing it. It's going to give the business owners, especially the small restaurants here, a chance to prove their ingenuity and answer decorating and handling this. And I think it'll be, I look forward to see some, a whole different environment out there of doing it. So for those that survive, I hope they do a great job. Thanks.
Any other comments?
Mr. Chairman?
Trustee Malani.
This is interesting because I was watching the Sunday morning news the other day, and there was an announcement that 49 states had eased their social distancing restrictions. And I was surprised when I found out that the outlier wasn't Illinois, it was Connecticut. It was surprising to me because it's making me wonder how Illinois made it into the list of 49, as we seem to be kind of kicking the can down the curb instead of evaluating how we can actually salvage our economies and maintain the health and safety of our residents at the same time. So that being said, I think this really gives Orland Park a leg up and, heading in the right direction. Gives an alternative for people to eat at restaurants, maintain that adequate level of distance, as Trustee Calandrello just mentioned, and also keep the employee and the patron safe as well. I think that's key to a program like this. And more importantly, we're going to help those starving businesses dig themselves out of the turmoil they've been facing over the past few months. So I think there's many areas that have actually opened restaurants with 50% capacity restrictions, have been able to move their tables 6 feet away from each other, limit numbers of people at tables, and on top of that, open outdoor seating as we're talking about. So as we're all aware, I think there's several businesses that will probably never recover and never be able to open, but this will actually be able to give some of those restaurants and businesses the opportunity to start recovering now. So thank you for putting this together.
Any other comments? So I'll just close with, we know that restaurants will eventually open. I hope they move, I hope the governor listens to what the IML has asked for and what we have asked for to move them into phase 3. I also know the city of Chicago's asked for them for that move as well. This way they can get their site plans in now. I encourage them to get them in now. They can do their construction, their tents, whatever they want to do outside. They can do that now so they're ready to hit the ground running when that opening occurs, because we all know people are probably going to be a little more reluctant to go inside. So I think it's great to get this done ahead of time. It's also a great example of implementing good ideas quickly. Nabia is actually the one that brought this idea to me a little over a week ago. So I really appreciate you, Nabia, for bringing that to me. Within 2 hours, we were working on the ordinance and thinking it through, and we got involved all the staff to make sure that we got it done right. It was actionable, it's smart, it's helpful, it doesn't drain any of our resources, and it's going to help our restaurants immensely. So great job on that. Nabia, George, Ed Lilo, who I know worked on it, and anyone else who worked on this, who brought this to life real quick, I really appreciate it. It's great work, well done. Call the roll.
Trustee Healy?
Aye.
Trustee Katsinas?
Aye.
Trustee Fenton?
Aye.
Trustee Dodge?
Aye.
Trustee Calandrello?
Aye.
Trustee Malani?
Aye.
Mayor Pico?
Aye.
Budget adjustments for second quarter 2020?
Mr. Mayor?
Trustee Healy.
I move to recommend to the village board to approve an increase to the fiscal year 2020 revenue budget of the general fund in the amount of $117,570 a decrease to the fiscal year 2020 expenditure budget of the general fund in the amount of $551,508, a decrease to the fiscal year 2020 expenditure budget of the water and sewer fund in the amount of $120,230, a decrease to the fiscal year 2020 expenditure budget of the recreation and parks fund in the amount of $105,609, an increase to the fiscal year 2020 expenditure budget of the insurance fund in the amount of $80,000, an increase to the fiscal year 2020 revenue of the motor fuel tax fund of $1,247,056, an increase to the fiscal year 2020 expenditure budget of the motor fuel tax fund in the amount of $1,247,056, an increase to the fiscal year 2020 revenue budget of the capital improvement fund in the amount of $1,247,056, and an increase to the fiscal year 2020 expenditure budget of the capital improvement fund in the amount of $1,247,056.
Welcome to fund accounting.
Do I hear a second on that mouthful?
If he could repeat it, I'll second it.
I'll take that as a second from trustee Dodge. Are there any questions or comments on this?
Mr. Mayor, if we could, we have a little presentation.
Okay,
I'll try to make
roll
it
with
quick.
it.
So I'll try to make this kind of quick. So this is just really giving an introduction into our revised long-term financial forecast based upon the events that are going on. So there's a lot of different places that we looked at to get revenue projections for the upcoming years. IML had published a good article, and they've updated it a few times. I think the biggest thing you can see there is a survey of multiple states, anywhere between a 9 and 17% decrease in revenues overall. Using the Illinois-specific data, the governor issued a revenue forecast, and you can kind of see what's listed there. There's some pretty significant declines. Mel and Ifany, they come out with their report once a year. They happen to come out with it last Friday, and they're projecting about an 8.7% decrease, which is the largest decrease since 1988. Go ahead and flip. The governor's office of OMB, this one was pretty helpful because it actually goes into fiscal year 2021 because the state's fiscal year is going to start in July. So that helped us kind of understand not only what's going to happen to our revenues in 2020, but also in 2021. And I think the biggest items to kind of look at are down at the bottom. And not only do we talk about 2020 at the top, but down at the bottom, it shows even in 2021, we're going to see significant declines in income tax revenues as well as sales tax revenues. The sales tax is obviously the one that really harms us given the dependence we have on our sales tax revenue. So looking at all of those different sources, we came up with what we were going to use as our assumptions for the long-term financial forecast. Sales tax, I think if you were looking at your presentation, there was a typo, but we corrected it here. So in 2020, we're estimating it's going to go down about 12.4%. And when you think about what's been closed for 2 months in a row, it kind of makes sense. Our overall budget for sales tax is about $20 million. So it's going to be pretty significant. Income tax, we've kind of talked about already. We think that's going to not only decrease in 20, but also in 2021. 2021 maybe is going to not go down nearly as much because some of the taxes are just going to be deferred into 2021 as opposed to not collected at all. Motor fuel tax, obviously nobody was traveling around for a few months, so we're going to see a significant decline there. Use tax, most of the research out there was that it's going to be flat. The simplified tax is going into effect on July 1st, so that's going to cause our use tax to probably go down and maybe help a little bit with our sales tax. And then per board direction, we continue to keep our property tax levy in total flat for the out years. Some of the smaller revenue sources, such as gaming tax, probably not a lot of gaming going on with all the restaurant closed, so we've got a pretty significant decline in there. That's not a large revenue source to us, so that decline won't be as significant. Parks and Recreation fees, we have a pretty big estimate in there for lost revenue. That was only through May 31st of 2020. That was assuming that all of our facilities would open in some capacity on May 31st of this year. And then we're going to pretty much keep it flat probably for 21 and 22, and then start projecting some increases going forward. Other operating revenues, our assumption was, are just going to remain relatively flat, so we kind of estimated between a 1% and 2% increase per year. So these are the revenue estimates as of today that we are projecting that we're going to lose just in fiscal year 2020 alone. And these estimates are what are built into the long-term forecast that we'll show you later. So sales tax is obviously a big one. We looked at the different SIC categories that we have. We looked at, retail is obviously our largest source. Auto dealerships, while they're still selling cars, they're not selling them at the same pace. And then obviously our restaurants are our third highest category of sales tax, and the majority of them have been closed. I just kind of listed out the dollar amounts here. Income tax, we already talked about, motor fuel tax, gaming, recreation fees. At the time I was putting this together, recreation had estimated $650,000 in lost revenue. And like I said earlier, the revised estimate I received today is about $1.1 million. So it's basically doubled by pushing back a number of our programs for an additional amount of time. Civic Center revenues, they've had tons of cancellations. I think they've got cancellations coming in that are for the month of August now. So there's a lot of cancellations going on there. So these numbers were built into the 2020 budget. We reduced the revenue by that and used that revised revenue estimate for the long-term forecast.
Mayor Pico, just before we go on to the next page, go back if you could, just one. What's the page total, Anne Marie?
It's about $4 million.
Okay, thank you.
Sorry, I should have done that.
That's total, all things, it's only 4?
Yeah, it's a little bit over $4 million. And then when you add in the additional amount for the recreation, obviously
No,
it's going to be higher.
4 million is 4 million.
4.5,
so-
4 3/4.
Yeah.
Yep, thank you.
Yep.
So expenditure assumptions that we put in here, we did do a 3% annual total compensation increase for all groups. We know that's not going to hold through for all of them, but we made the assumption of the 3% given the board's direction. We did factor in the cost of the ERI program for everybody that is participating in that program. Operating expenditures, insurance premiums going up slightly each year. Computer maintenance, as we continue to improve both our technology infrastructure as well as our systems, our maintenance is going to go up on that. Vehicle costs, maintenance costs, given some of the plans that we're looking at, we thought we would probably have a 50% decrease in the actual maintenance costs. The leasing, I know George we talked about this a little bit differently. But we're averaging that we're going to spend, whether we buy vehicles or lease them or some hybrid of that we'll probably spend about $1.2 million per year. Technology improvements and operating capital improvements, we factored in about $1.2 million, given the age of our buildings and the amount of technology improvements that need to occur. So these are the different expenditure assumptions that were once again built into the long-term plan, or long-term forecast, I should say. Go ahead. So this talks a little bit about the budget adjustment that the board just approved, increases in revenues as well as expenditures. I know there was a lot of duplicate numbers in there. That's all about fund accounting and interfund transfers. So the increase in the general fund is due to the civic contribution that's going to be made based upon our energy aggregation vendor. We've got a decrease in the general fund, water fund, and rec fund related to personnel changes, including department transfers, reclassifications, position eliminations, and furloughs. The increase in the insurance fund is due to anticipated additional unemployment claims. And then the bottom two are all related to the Rebuild Illinois funds that we're going to be receiving. You guys, we kind of already went through this, just a summary of the full-time staffing by year. All of the staffing change that we previously talked about in the executive session are built into this model. Other expenditure reductions, we also talked about this previously, so these are all built in. So then I just wanted to touch on our reserve policy. Trustee Dodge, I know you made a really good point that part of what we reserve is that rainy day fund. The way that the policy was approved by the board, I'm just going to kind of jump down to the bottom. There was a 5% contingency reserve, which was for exactly what James was just talking about, for that rainy day, for when you have unexpected significant changes in revenue or expenditures. And then the 15% was really meant to meet just excess cash flow needs of the village over time. So it's really, the 15 is what, in my opinion, as the outgoing finance director, that I would say that the board should leave there. That 5% that we talk about, the contingency reserve, is something that you would want to maybe dip into if you needed to help balance the budget for the upcoming years. So there's a couple of graphs. So this is where we are long-term forecast-wise, where we are today with the budget adjustments that the board has approved over the last few board meetings, as well as the budget adjustments that you approved tonight. This is where we are based upon all the assumptions that we just talked through. If you remember, as part of the budget process, the board's goal was to keep at that 20% if we were able to over the long term. So we kind of always looked at that 5-year span for keeping that 20%. So this, I think, is where we'll be if we do no additional expenditure reductions. So the board will be able to, the village will be able to approve a 2021 budget without making any significant changes. But then after that, when you get to 22, you see that significant dip. Go ahead, Dave. If we get another $1 million in additional expenditure cuts, and these cuts really would need to be made either now to affect the 2020 budget or as part of the 2021 budget cycle, it'll give us another year. So you'll be able to stay above that 20% through 2022. But then you see some pretty significant dips because our revenues just are not keeping up with our expenditures. You're using that reserve, and then you don't have it in the next year to help fund your budget. Last one, this is where we get to stay in that healthy 20% range for the next 5 years. Like I said, that 5% that's what it's there for. Just keep in mind that your fund balance reserve policy helps you get that strong bond rating, helps you stay liquid, helps you manage these types of catastrophes that can happen. If we didn't do this all these years and maintain this balance, we wouldn't have it here to help us get through this. So just something to think about. So that's the end. If there's any questions, we just wanted to kind of talk about the magnitude of what we need to do if we want to kind of stay at that level for a number of years.
Mayor Pico?
Thank you. Trustee Dodge.
Just thanks, right? I mean, we have to have these conversations because this is.
It is what it is.
Yeah, it is. And, we've been in the position we've been in financially in terms of our strength because of the strength of retail. Retail is an industry that was challenged. It's now doubly challenged because of the pandemic, let alone just the entire economy. So knock on wood, we can all quickly get back on a path to a new normal. So thank you for the details and the numbers, and I appreciate hearing the absolute number we don't want to go below is 15. So we've got a bit of, if you will, in my terms, not yours, a 5% rainy day fund, so to speak, to be financially healthy.
Any other comments? So I have a few comments so the residents understand a lot of these budget amendments too are related to 141 furloughs that the village must make given the current fiscal times. The economic calamity that we're faced with is very, very real. Every day that we meet the metrics, which we've been meeting, and you're going to see that in a minute, that have been given us by the state, but we delay opening, is going to just make this worse. Unlike the state and the county, who they're both broke, and they were likely both broke and bankrupt before COVID-19 even hit. They've stopped really paying anyone. Well, they haven't stopped paying any of their employees, and we're furloughing people, and their employees aren't even working. They've closed most of their offices, but yet they're still paying people. They don't seem to be worried about their fiscal responsibility, so that's a bit concerning. They've threatened the village with withholding money that's designated for municipalities. I was on a phone call last night that included the state Senate president, who pointed out that the state has received over $3 billion in funding from the federal government. $800 million of that is dedicated to municipalities outside of the city of Chicago because they get their own money. Cook County also received $500 million dedicated for its municipalities, other than Chicago, because again, they get their direct funding. We haven't seen any of that, neither from the county or from the state. And again, last week, the municipalities and government agencies were threatened again to withhold these funds if we don't comply with their orders. It's positively Orwellian. Our share of this federal funding, just broad strokes, is approximately $5 million. That's a pretty big hole that would help us fill. That's the federal government. It's not coming from the state. It's not coming from the county. It's coming from the feds, and it's dedicated to us. So that's about $5 million that's being withheld from us. They have it, and we're not seeing it. That would help us keep our services, help us keep our employees, help us get through some of this time. So hopefully, eventually, they get us the money. But so far, they've been inept and fiscally irresponsible, and hopefully that improves. The village, however, in the last couple of years, and I want to thank the board and the previous board, we've made about 5% cut in our full-time staff, as you saw. In the last couple of years, we've also cut about 7.5% out of our operating budget. That's really helped us get through this time. It still hurts, as you see. It hurts a lot, bless you.
Thank you. I went that way, it's fine.
It really does hurt at this time, but we're able to absorb it largely because of what we've done. There are other municipalities that are not nearly as fortunate. So thanks to the previous board, thanks to this board for making those decisions. We have fiscal responsibilities we have to address. The continued inaction and ineffectiveness of the state really leaves us no choice but to address these things now. We hope that these actions are short-term. We hope we can bring our employees back and start returning to normal soon, and let's really hope that we do better than these conservative, I hope these are conservative estimates and forecasts, and I hope we end up doing better and we recover faster, because that'll be better for everybody, not just for the Village of Orland Park, but for all our residents. So call the roll.
Trustee Healy?
Aye.
Trustee Dodge?
Aye.
Trustee Fenton?
Aye.
Trustee Calandrello?
Aye.
Trustee Katsinas?
Aye.
Trustee Malani?
Aye.
Mayor Fico?
Aye.
Resolution concerning the Village of Orland Park response to the economic emergency that has resulted from Governor Pritzker's stay-at-home executive orders.
Mr. Mayor?
Trustee Katsinas.
John, may I have a resolution number, please?
2022.
Mr. Mayor, I move to adopt resolution number 2022 entitled Resolution Concerning the Village of Orland Park's Response to the Economic Emergency that has resulted from Governor Pritzker's stay-at-home executive orders, as amended, including an amendment to the title of the resolution so that the title of the resolution number 2022 now reads, Resolution Concerning the Village of Orland Park's Reopening Plan in Response to the Economic Emergency resulting from the Governor Pritzker's COVID-19 related stay-at-home executive orders.
Second.
The motion's been moved and seconded, and before we open them up for discussion, I do want to give a little background presentation of some of the data and the numbers, and then I'm sure there'll be a little bit of discussion. The first page here, so the CDC, when I was on my first call on this on March 15th, thanks to Mayor Lightfoot put this together for the regional mayors, we actually didn't hear from the state for a couple weeks after this, and they gave us a lot of information. And the CDC, what they told us then is, they said there's really 4 things they look at during an outbreak. So it was very informational. One is they look at morbidity, so how many people die from it. As they said at the time, there's really not much they could do about that because there was no known treatments, so that was going to be what it was going to be. Of course, they would look for treatments, but they didn't know anything that was going to work for it, so that was really something that, while they would look for treatments, they weren't expecting. The second was spread and how fast this thing spreads. Now, this is back on March 15th when we had only a couple cases in the state of Illinois, and the words were that the cat is out of the bag on this, and we're going to have a pandemic. So that was back on March 15th. I know it wasn't declared a pandemic by the WHO for several weeks after that, but they said at that point they knew it was out of Wuhan. It was there was no way, the way this was spreading, it was not going to be a pandemic. So they said they were really focused on the last two levers, which is protecting the healthcare system and balancing that against the economic damage that any actions you take cause. So protecting the healthcare system, we all have heard this over and over again for the last 2 months. It's flattening the curve. So that's what protecting the healthcare system is. And what does that mean? I think a lot of people misunderstand what that means. It doesn't mean that you're going to have less cases. It means you're going to have less cases at one time. But if you look at the spread of time as you flatten that out, you're still going to have the same number of cases unless you come up with some kind of a cure or vaccine, or somehow it peters out and mutates into something else and doesn't spread as much. So the idea is to spread that out, and the reason you're doing that is because you don't want the healthcare system to be overwhelmed. Because what they're concerned about is getting so many people to come into the healthcare system that people that would otherwise live from this, if they were treated for their symptoms, don't live. So because they just can't get into the healthcare system. So that's the idea behind flattening this out. It's not to prevent deaths. It's, as the CDC put it, it's to prevent preventable deaths. So that's really what they're focused on with this. And so we've done a great job doing that. It's come at great cost to the economy. Again, the goal was preventable deaths. We have done that. So as you know, other states have been opened up for several weeks with no significant issues. These are the ones that I could get relatively quickly, get their and that's not, I'm sorry, that's not hospitalized by report date. That's actually number of cases. So I apologize for the header on that. That's incorrect. But as you can see, Indiana's been it's been flat the last 2 weeks. Actually, it's down from where it was 2 weeks ago when it opened. But you know, so they're monitoring that closely. You can see Iowa's done the same thing. It's dropped and then kind of leveled off. And then Georgia has continued to see a decline. We're not going to see a giant decline to zero here when we reopen. The CDC is not expecting that. No one's expecting it. What they want to see is something like this, something that's manageable. The healthcare system still does not get overrun. So then you can move to the next phase and the next phase. And we're fully open. We may still see a curve like this because the healthcare system can absorb that. That's the key. So this is not about going to zero cases, and people that think that it is, that's just not what this is about. Because the whole time we stay closed, we continue to damage our economy. As we all know, we just saw the numbers. It's affecting the village. It's affecting some of our residents. They're unemployed, et cetera. So the goal as you reopen is not to bring it to zero cases. It's to keep it flat or slightly declining so that we're not seeing a spike. And so far, Indiana, Iowa, and Georgia have seen that. Go ahead and flip to the next page. So the governor has indicated that there are four different regions. He's used the 11 emergency management regions, and he's combined them into 4 separate regions. This is where the majority of the state, in fact, the entire state, except for the city of Chicago, is not happy with breaking it into 4 regions, because what it does for us in our regions, it ties Chicago into our region. So for us to advance to the next phase, Chicago has to figure out what they're doing. And Chicago right now has 21% of our state's population approximately, and it's got 39% of our cases and our deaths. So Chicago was the one laggard of meeting all the metrics. Everyone else was meeting it, and especially the people downstate. A lot of those counties don't even have a case. And so they're obviously very upset with everything being held back. It does make sense to go into regions. I think the IML has asked for that to be in the emergency regions, which are the 11 different regions, which would put us outside of the city of Chicago. So that's one of the things that we've asked for. If you move on to go to the website. So we're going to show you now the metrics. So these are the metrics currently. Every region, so this is our region, we meet every metric the governor has set forth to move forward to the next step. This is the governor's metrics, the IDPH site. Flip down a little bit. So there's the rest of the metrics. So we meet them all. If you keep rolling down, the entire state meets them all. So keep scrolling down. So the entire state meets this, and that includes the city of Chicago. So again, the metrics are met, and back to the impact on the economy that this is having, every day that we delay, when we've met the metrics, it's that much slower till we return to normal. Because we know when we open, we're not going to see a rush of people. So that first week, 2 weeks, we're seeing it in Georgia, Florida. You know, there's a slight uptick in activity, but it's not everyone rushing back. So that's going to take some time. So the sooner we can do this, the better. Flip to the next page. The slides, yeah. So one of the governor's metrics is testing percentages. So testing percentages across the state have averaged 12.2% positive. Now, we can't see the testing percentages for just suburban Cook County, unfortunately, but that's the statewide. We can see it for Orland Park because we have been tracking this for almost a month. We're at 12.7% specifically in Orland Park, so we're well below the governor's threshold. And you can see going back to like April 24th, there's only like one day that was above 20, and it's actually an average over 14 days. So we're well below that on the testing. Now, I personally don't like this metric for a couple reasons. It can be manipulated either way. You can do less tests and test people you know are sick, and it's going to bump that percentage up. You can do a lot of tests of people that you know aren't sick, and you bring that number down. So I don't think that's the best indicator that we have. One of the things that Orland Park is tracking and that we're tracking as part of our back to normal plan, flip to the next page. I think this is a better metric. It's hospitalized by report date. Because what do we really care about? We really care about who's really sick. Who needs to stress our hospital system? Back to the flat curves, we know that the hospital is going to see cases. So if we're testing more, we know that the numbers are anywhere from 10 times to 20 times more people have this than we've tested for because they're asymptomatic. If we're testing a lot of people and we're catching all the asymptomatic cases, that's great. But that's going to show a lot of cases. But they're not going to end up in the hospital. It's going to drive that hospital rate way down. And as long as the hospital's not being overrun, that's the key thing. So this is a 7-day moving average of the hospitalized by date. And you can see, and this is for suburban Cook County, so it takes out Chicago, but it includes all the other suburbs, except for a couple that have their own health departments. So if you look back to the beginning of the month, we're in a steady decline. We're less than half of what we were at the beginning of the month. And if you look back a week prior to that, it was, higher still. So we're down, a third of what we were 3 weeks ago. So we are in a steady decline on that. So that's good news. That's exactly where we want to be. So flip to the next page. So another one of the governor's metrics is ICU bed and ventilator beds being stable or declining. So that's so it's a little bit subjective on that. But if you look across the state of Illinois, and this holds true in our region as well, but we just can't see the data. We just can talk to the hospitals and get the feel for it because we don't get this data reported to us. If you look at the beds, it's stayed very stable and slightly declining. We did have a spike here earlier like 2 days ago, but that may be an anomaly in reporting because everything else is definitely going down. Flip to the next page. So another one of the governor's metrics is that we have to stay above 14% ICU bed and ventilator bed availability. And that makes sense because we don't want the hospital system to be overtaxed. So we want to keep watching that as we open up. As you can see, ICU beds and ventilators have met this threshold for over 3 weeks. That's how long it's been being reported. So it's probably a month that this, or more, that this has been good. In fact, there was only maybe 2 or 3 days that this really became a problem, and that was when the Stateville prisoners were dumped out into St. Joe's Hospital in Joliet. When that happened, it taxed our system for a few days until the National Guard got put up some tents and some medical facilities at Stateville, and then we returned to normal. So as you can see, ventilators actually, there's so many ventilators that they've stopped reporting it on some of our reports that we get because there's so many of them. So it's not really an issue. So at the end of the day here, we meet all of the metrics. It's time for us to move to the next phase. And it's not because we're rushing things, it's because it's a balance. It's a balance between the economic damage and the harm that we're causing people with all of the increased mental health issues, suicide issues, all those things that we just talked about, abuse, all of those things, people being out of work, all of those things, we have to balance those versus the healthcare system. And the whole goal of this was to not overrun the healthcare system. we did not overrun, we did a great job. We did not overrun the healthcare system. We don't want to keep trying to do this in perpetuity, or we will absolutely destroy our economy. And then you won't have a healthcare system because you won't be able to afford to pay for it. Flip to the next page. Here's the big failure of the state, and we're not the only state that failed in this, but a lot of states did. Long-term care facilities represent 49% of the deaths in the state of Illinois. In Orland Park, they're 100% of our deaths. So we have 25 deaths. They are all in long-term care facilities, according to the IDPH website. This is the thing about long-term care facilities. The state is solely responsible for the oversight of those. It's not us. It's the state that's responsible for this. So if you think back, there was a tragedy with the Legionnaire's disease in Quincy. 13 people died. We heard about it for 15 months, and it was a tragedy and needed to be fixed, no question about it. This is 2,000 people. 2,000 people. And we're not getting nearly the coverage that we should in this. This is a travesty. Flip to the next page. So we know that, I don't think anyone's shocked by this, that people over 60 are the targets of this disease. The disease really does a lot of devastation to people who are older. The CDC, now they report it from 55 and up, so that if, 55 to 64, 65 to 74, so it's a little bit different, but 92% of all deaths are over the age of 55 for COVID, and that's actually not through 5/2, that's through 5/13, so that's through just a few days ago. So that number's held pretty steady, and I don't think it's going to change a lot. Move to the next page. Cook County and Illinois data confirm that COVID becomes even more dangerous with age. What you see on the left there is hospitalization by age. So if you get COVID and you're over 80, there's a 51% chance that you're going to end up in the hospital. 46% if you're 70, and then on down. So you can see it's much more dangerous for those who are older. The morbidity rate, so the death rate by age, if you're over 80, 44% chance that you're going to pass away from this. And there's only a 51% chance you're in the hospital. So you can see that it's very, very dangerous the older you are. One of the things that concerns me about the governor's and the state's Restore Illinois plan is that the CDC actually says in all of their recommendations for all of their phases that until the economy is fully reopened, that people over 60 and who are immunocompromised shelter in place as much as they possibly can, and that long-term care facilities do not receive visitors. The state's plan completely fails to address this, which, given the fact that 49% of our deaths are in long-term care facilities, and this is how much death is in the older population, that's just unconscionable to me that that's not in there. Now, that's something we've asked for. So several mayors sent a letter to the governor asking that this is changed, and so hopefully he'll take that under consideration and adapt his plan. Like all plans, they're not perfect, and they can be adapted. Flip to the next page. So I'll go back to, we've met the metrics for about 3 weeks now. It's time to open. We've accomplished the stay-at-home order. We're not overwhelming the healthcare system. The governor established new metrics. We've met those. Other states have started opening. They haven't seen significant case increases, if any. We've got to keep watching that. If we see places where they're spiking, it looked like Florida might be creeping up a little bit, we got to see why. Where are those tied to? What's causing it? Maybe there's something different that we have to open in a different way. Nursing homes represent almost half the deaths in Illinois in all of Orland Parks. And this virus is significantly more dangerous to people who are older. And the state has failed its vulnerable citizens, and the plan ignores them and fails them again. I can tell you that our plan that we've put together, we emphasize this very action, and you're going to hear more tonight. We're going to talk about the resolution, but part of that resolution is to direct staff to look at every option we have available to us to try to regulate the long-term care facilities as much as we can. It's not something that municipalities typically do, but maybe there's some things we can do. So we're gonna really dig deep on that to try and figure out what that is. With that, I'll open it up to comments, but I wanted to give everybody the background data and the background information that was up to date. comments?
Mr. Mayor?
Trustee Healy.
I applaud this resolution. I think it's great. I regret that I can only vote one time for it. The pioneers who founded this country was built on, they took chances coming over on a Mayflower, taking Conestoga wagons across the country. We should all be taking chances out there. I mean, there's a chance when you walk across the street, something could happen. Somebody told me the other day that Father Time is undefeated. We're all going to pass away. As the oldest one on this dais right at this very moment or whatever, but I'm not worried at all. Let's go. I would open up yesterday. You're doing more damage than the good, and for not taking chances. And why does the state not listen to these facts, these things? Why don't they act? Is it because they're professional politicians and don't have any concept of the real world out there? I'd say let's pass it. I doubt if they're going to listen, but I think we should pass it. And the other sections of it, it seemed like very wise things to have Klein Thorpe look into a couple of things. And I'd say let's get this village open.
Mr. Chairman?
Trustee Malani.
You know, as I mentioned earlier, and as Mayor Pico just mentioned, you know, our state is failing us. They're not providing the guidance, the direction, and the coordination as they should be. They're unresponsive to our requests, and they just keep kicking the can down the road, and they're constantly moving the targets, as we've mentioned here tonight. I read a news article from WTTW it was May 17th from Amanda Vinicki, and I'm using that because I'm probably going to quote a lot of this. Basically says, our governor has recently put a tiered plan into place to penalize any businesses that open in defiance of his stay-at-home order. While Pritzker's executive order requires restaurants, salons, and gyms to remain closed on-site patrons due to COVID-19, the rule change codifies it under the IDPH regulations, violators of which can be charged with a Class A misdemeanor. Misdemeanors in this category are between $75 and $2,500, just for opening your doors. He's also threatened other counties. Counties that try to open in defiance will not be reimbursed by FEMA for the damage they caused themselves. So let's take away the federal money that they deserve. Local law enforcement and the Illinois State Police can and will take action. Pritzker also said on Wednesday that businesses and individual professionals that are licensed by state agencies can be held accountable for defying public health orders. Law enforcement has made a point of taking an incremental approach, focused first on communication and encouraging compliance. Should that not work, law enforcement has the option to issue a cease and desist order. But if business owners continue to refuse, the next steps would be to issue a closure order, meaning the establishment would have to shut down completely, including their curbside and delivery orders, and possibly pull an establishment's liquor license. Illinois House Republican leader Jim Durkin responded to this, saying, these rules are a legal overreach and beyond the scope of the governor's authority. It will be a dark day in Illinois when we charge small businesses with a jailable crime for salvaging their livelihoods. Now, you know, I've been actively tracking the analytics and the data from multiple sources during this time, from Johns Hopkins University, the IDPH, Cook County Department of Public Health, and the Will County Health Department. I've been on several of the governor's calls, and I've been on several of Will County's emergency management and health department calls. And I've watched this data, and it's hard to argue with the facts. Our mayor has been providing those facts in his video updates, and as we just saw here tonight. This evidence shows that we're exceeding the governor's benchmarks. However, no changes are being made to the plan. Plans are not set in stone, and they can adapt to situations. If plans do not adapt, they usually fail. Our staff put together a great plan for reopening, and I would like to see it implemented. However, I think this resolution is a good approach for now. If the legislator cannot persuade the governor to make changes to his plan, maybe legal action may help change his mind. Thank you.
Mayor Peacock?
Trustee Dodge.
So just a couple of broad comments, three different key pieces I'd like to touch on. So one, I'd like to make sure that everyone understands one, thank you for letting all of us have some input to this. And like any types of resolution or ordinance, you know, we all have our disagreements with individual parts of this. But I want to make it very clear, like we did a recent ordinance, we're asking the executive branch and the legislative branch of the state of Illinois to come together and give us a more flexible plan so that we can get the economy moving again, comma, and this is important, paying attention to the data, the science, and the modeling and the actual experience of what we've seen in Illinois and our nearby states, and broadly, you know, these all across the states of these of America. So one, thank you, right? Appreciate the input. It's a tough situation on everybody. This is the way that democracies work, right? It's our God-given right as Americans to disagree with our government and speak up about it. I'm pretty sure the First Amendment's a pretty important one. But two, I wanted, with the forbearance of the board, to read what I think are some really important points in this resolution. And I do this to try and make sure that everybody who was watching this or sees this or sees the Orland Park Board acting, they understand what we're doing and what our intent is. So as Trustee Milani said, we're all looking at what's publicly available in the data and the science and the modeling. And Mayor Peacock, you touched on this. The challenges with COVID-19 are heavily concentrated with older citizens that have serious comorbidities. The data could not be more clear. The data could not be more clear from these United States, let alone a number of countries around the world. So we all strongly encourage you, the individual, to take extra precaution. And if you are in advanced years and you do have underlying health conditions, to stay vigilant, take the extra measures to protect yourself, including extending your own isolation, self-isolation, maintaining that social distancing, and unfailingly track the CDC guidelines until effective treatments, and there's hope, but nothing's necessarily scientifically proven yet, while we're all waiting for vaccines to be developed. So that's an important piece. A second one, is as you look at the actual infection rates of this thing, it looks a lot like what the pandemic researchers have known for many years. We just didn't know this particular virus is going to come up and do what it was going to do. And so what's happening around the world is the initial models, which are now been proven not to have been terribly well built or terribly well thought through, are flat out wrong in terms of their worst case scenario. The challenge for us as a nation and as a world is many of the initial emergency orders, not just Illinois, but everywhere, were predicated on that worst case model because, yeah, models can be useful, but I also know from my experience that they're often wrong, and we haven't altered the plans and adapted to the new science and adapted to the new data, and that's what my support for this resolution basically is seeking to get from the state. And then a third piece that I'd like to make is for all the people who are hearing the voice of Orland Park and what we're trying to do and what we're not trying to do, you know, you have to act as an individual. Into and of yourself, as a family member, as a business owner with workers or people that you care about, it's incumbent on you, the individual. We're in this together to maintain and follow those CDC guidelines and then protect the people you love and the people you're in contact with as part of your daily life. And then for all the folks that I've bumped into at a Menards or Home Depot or Lowe's at 6 a.m., because that's when I prefer to shop now, just to be largely alone in the aisles, you know, it's not about you in terms of asking you to wear a mask for a while until we get through this. It's about the rest of us and the impact you may inadvertently have on a lot of different people. So again, I can't come back and emphasize this more strongly. Individual actions are what gets America through this, consistent with the science and the guidelines, and that's an important piece of what we tried to communicate with this. And then there's, you know, quite a bit of folks, do we sue, do we litigate, do we not? I think we've settled on a pretty good option as a board, and God is my witness, I sincerely hope that over the next 2 weeks, the data keeps trending in the way that it's been going, and all of this was just so much angst and we actually have a solid executable plan based on the science, based on the data, that lets us reopen Illinois as appropriately, given the way this disease is running, that we now know definitively from the data and science. So with that, Mayor Pico, I appreciate your time.
Any other comments?
Mr. Mayor,
Trustee Calendro.
at this time, based on everyone's comments, I do want to make an amendment to paragraph 17, which is on page 3. I'd like to strike the language, the Illinois Department of Public Health, and insert federal and state governments were, and then have the sentence continue. So again, 17th whereas, page 3, which is the fourth one on that page, striking the language Illinois Department of Public Health and inserting federal and state governments were.
Do I hear a second from anyone?
Mayor Pico, I'll second it so we can talk about it.
Okay.
Trustee Cal, just want to make sure I know the paragraph you're referring to. You said third page?
It's the third page. It's the fourth paragraph on the third page. Any comments?
Mr. Mayor, the reason why I brought this amendment up, I think it's just factually, it's been documented. It's been a couple, both our governments had issues with PPE equipment, and I'm just trying to make a productive ordinance resolution.
Any other comments?
Mayor Pico, my comment was, I understand, I believe, the essence of what was in the original resolution. I believe I understand the essence of what Trustee Calandrell is trying to do. My frustration as an individual American who happens to have access to a microphone is we as a nation and as a society were not ready. The risks were known, so here we are. So, you know, I get it. I'm not quite sure exactly, you know, how best to express it. I mean, there's a lot more could have been done at all levels of government. Quite frankly, this is not a local government. This is not a municipal government responsibility. This is counties, this is states, this is federal, and all of the various tentacles and agencies. And, you know, like I said, as a nation, we weren't ready.
And I guess what I would say, what I would jump in here and say is the reason that, you know, I'm not in favor of changing this is because we have visibility to this, plus this resolution is to the state. We don't necessarily have visibility, we don't have visibility to the federal government. What we do know from the state is that they said that they haven't been able to fulfill unemployment requests, but they've got the money from the feds, but they can't fulfill it. Well, I already told you that I was told yesterday there's $3 billion sitting down there for the state from the feds, and they're not distributing it to the municipalities. I know that that IDPH is responsible for having masks for our first responders in a case of an emergency, and they didn't have any. And the federal government does have some responsibility for that, but then again, they don't usually prepare for 50 states all at one time, whereas our state didn't even have it for us, and they still don't have it for us. We had to go out and find masks for ourselves, which we did, and then we, to Trustee Dodge's point, we had to go out and find masks for our medical offices because they couldn't get it from IDPH or the Cook County Department of Public Health. That's nuts that we had to go find it, but we could find it. We found it. Why couldn't the state find it? And why couldn't IDPH? They don't have a, you know, that's one of their key responsibilities, and they completely dropped the ball on this. So that's why I'd like to see it just stay IDPH, because I think it specifically calls out the agency that specifically is directly impacting the Village of Orland Park. So I would not support that amendment for that reason. Not because I don't understand your frustration, because I certainly do, but just because in this resolution I think the IDPH is the right language. Any other comments? We'll call the roll on the amendment to strike state of Illinois and make it federal and state. So a vote yes would change it to federal and state.
Trustee Calandrell?
Aye.
Trustee Dodge?
Aye.
Trustee Fenton?
Aye.
Trustee Healy?
No.
Trustee Katsinas?
No.
Trustee Malani?
No.
Mayor Pico?
No. Motion fails. Are there any other comments on the main motion on the resolution?
Yes, Ms.
Oh, sorry. No, please.
Oh, okay.
Trustee Calandrello, you still have the floor.
Ladies first.
Well, you still have the floor.
Okay, I guess, Mr. Mayor, I'd like to make another amendment. Page 4, whereas 3, which is number 25, I'd like to strike that whereas. So we're on page 4, it's going to be the third whereas. It says, whereas the residents of Orland Park have been without representation at the state level in Springfield since the beginning of the COVID-19 pandemic. And I'd like to strike that whereas, please.
Do I have a second?
Mayor Peak, I'll second so we can talk about it.
Okay, Trustee Dodge seconds it, so
I made this amendment because I'm just trying to make this a factual resolution. As you have alluded, the village has been working with our state reps or other reps of the department, and I just feel like this is inaccurate. As anyone who knows about legislative bodies, they're actually probably more productive when they're not in session than when they're in session. So I think that this just doesn't, it's not a productive whereas for this resolution. And I just rather see a constructive solution and working together. So I feel like this is just not accurate. Thank you.
Mr. Mayor?
Trustee Healy.
It's my understanding they weren't in Springfield. I don't know what the problem is.
They were in session, and you're right, they were not in
They're
Springfield.
not in, it says state level in Springfield. I don't know. I think I'm kind of resentful that they were not in Springfield. I think that they get paid pretty well. They've got some great pensions. What have they been doing? I mean, they could have gone down there and kept social distance, but, I mean, there's a lot of things to be disappointed in this state for, and they're part, they're not, I think they're part of the problem, but as far as this being factual, I think it's, I think it understates the absence of representing, and not only in representing the way I feel, I don't know anybody down there, so.
Mr. Chairman,
Trustee Malani.
I guess I'll forward this question to Trustee Calandrello if he chooses to answer it. Which action specifically has our legislature actually completed that would make us want to take this out?
The legislature has been in session, but they have not been in Springfield for the entire length of the COVID,
So the
COVID
answer
thing, so they
is
haven't done anything.
They haven't done anything? Okay. I just wanted to confirm.
Okay. Trustee Dodge.
So the reason I seconded so we could have this conversation is my operating assumption is our state legislators are working in some way, shape, or form. I would have preferred, as a citizen of this great state, that they had found a way to be actively in session, much like what we did in the U.S. Senate and the U.S. House. It's the reason why I seconded, so we could have that conversation, because I wanted to make that point. So to the extent that we say, we can modify that or say you should have been in session, that's the spirit of this is, all three branches need to work the problem. And that's what I haven't really seen as an individual resident.
Mr. Chairman,
Trustee Malani.
one other comment to piggyback on what Trustee Dodge is saying here. But it seems that we were able to find out a way to continue running our government at the local level, like we are today. How can we not figure out how to run a state?
Mr. Mayor?
Trustee Calandrello.
I think that if you ask any of our legislators, the committee meetings, phone calls, running the state has happened. Now, if they're physically not, their butts are not on the seat, doesn't mean that they're not actively working. To answer your question, that was asked to me that I wasn't able to answer, but to answer, that's what legislators do. They work both in Springfield and out of Springfield. I just think that if you believe this is factual, it's still unproductive. So and that's just why I made the amendment.
Mr. Mayor?
Trustee Healy.
From what Jim said, reminded me that this will not be another chapter in profiles in courage. These people, it would have been nice to show some courage from our leaders. We haven't seen them stand up to the pandemic. We haven't seen them stand up to the pension disputes. We haven't seen them stand up to the tax. These people don't stand up to anything. It's just disappointing. I wish they'd show some courage and some backbone.
Any other comments?
Mayor?
Trustee Katsinas.
And I think the public perception of the absence, even though they might have been working at home, is that I think a lot of people that I've spoken to think the governor was acting solo. They didn't feel like they were represented, because of absence. We didn't see them on the news. We didn't have the check and balances. So I think that, I think this is accurate because I think that is an issue. They weren't front and center. They weren't out there. They could have been working, you work even though you're not sitting at your desk, just about everybody else does, but such a public figure. And the reassurance of them being there to the public, just like we're here tonight, is huge. So, thank you.
Any other comments? So my comment on that is, so I've been here, George's been here every day, and we've been working, and I can tell you that the legislators have been AWOL. That's the bottom line. I mean, I think we have one legislator who's been sending us some emails, keeping us in the loop that way. He did host one phone call, so we did have one legislator do that. We had another legislator who's not ours, who participated in 2 phone calls with me. That's since March 5th. Our other legislators they've been AWOL. They haven't been doing their job. They're in session. They haven't been in session. They need to be in session. So that's my position on this. With that, call the roll for amending striking the whereas that the residents of Village Orland Park have been without representation at the state level at Springfield since the beginning of the COVID-19 pandemic.
Trustee Calhoun.
Aye.
Trustee Dyer.
Aye.
Trustee Fenton.
Aye.
Trustee Healy.
No.
Trustee Katsinas.
No.
Trustee Malani.
No.
Mayor Peacock.
No. Motion fails. Any other comments? Trustee Katsinas, you had something for the main.
I'm sorry.
Did you have anything else, Trustee Calhoun, for the main motion?
Not at this moment.
Oh, Trustee Katsinas.
First of all, I want to say thank you to staff and thank you to the mayor who's been out in front, giving residents not only of our community but other communities a lot of information that was lacking from their own leaders. So I thank you, Mr. Mayor, for doing that with your facts and also the village staff who helped back it up. I think, even with one death, it's too much with the virus, but it's time to open up, and it's time about freedom, people's businesses, not only financial, but mental and other issues that can't be measured. So unfortunately, I've spoken to a lot of people who own businesses in this town, and there is a balance. You have to be respectful of people who have a fear, who are immune suppressed, and who have a deep concern about the virus. My husband is immune suppressed, and it definitely fits the categories here. So I'm very well aware of what I have to do and what I can't do. But that's a decision I have to make. I think looking at the facts and figures we were showing tonight, I think people have to make a decision for themselves, but they have to be allowed to make that decision. The government can't make it for you. Allow people to open up their businesses using precautions. And then it's up to the patrons to decide how you're going to handle it. But we have to be able, that's what our country was founded on, having the ability to make what's the right decision for each individual depending on your circumstances. So again, thank you, Mr. Mayor. Thank you, staff. The YouTubes, the information has been outstanding. I fielded several calls. They want you in Homer Glen, but you're not going there, so thank you.
Mayor Peacock.
Trustee Dodge.
As we get ready to vote for this, my sincere hope is that the people of Orland Park read what's in this ordinance, listen to this conversation to understand the intent and what we're trying to get to, and if there's questions or concerns, send them to the board.
Any other comments? Trustee Fenton?
It's very hard to hear what most of the board members have had to say, but I just wanted to, and you and I did speak in length today about this, resolution. So just a few comments that one of the reasons that I will support this evening is that one of the main concerns I had was that the fact that, the original one had that we were going to sue the government, the governor, or whatever, and that was taken out, and now staff and legal will look into the situation, which makes a huge difference. Although I didn't have COVID-19 when I was hospitalized, I was tested 4 times, and I was down at Rush in the thick of things, and I know how serious this is and how serious it is to our community, but also we have to look at, as Tina just said, as far as small businesses and the statistics that were brought forth in all the presentations this evening. So I think what the resolution is saying is that our legislators need to look at, number one, how the regions were broken up, which was not fair, which should have been what the city would follow. And everyone needs to think about this. Many comments were made about the older population. And yes, the older population is the most vulnerable, but yet some children have been getting it lately too. There again, it all goes back to best practice, social distancing, CDC requirements that for opening of businesses. And if people think before they do, I think everything can work out to the benefit of reopening, Orland Park, reopening the state of Illinois, and helping our small businesses, because every single day there's another business that has to close because of the restrictions that they have. So that's what I have to say as far as supporting this for this evening.
Thank you. Any other comments?
Mr. Mayor?
Trustee Calendrello?
Based on Trustee Fenton's comments, I do like to make propose one more amendment, striking the 38th whereas, which is the last whereas on page 4.
Do I hear a second? Hear a second? Motion fails for lack of a second. Okay, any other comments?
Oh, I just want to finish my comment. I only get 2, so.
Okay.
The reason why I made that amendment and why I'm going to be voting no for this, because I believe based on the current language, it's a non-productive resolution again. While I agree with a lot of the statements in it, and I agree with a lot of the actions the village has taken, and I want to help the small business and still want to help our small businesses, which I know the majority board did not want to help in the short term, and I respect that decision. That's our democracy. If you're outvoted, you move on. This resolution is not helping the village of Orland Park. It is starting an unproductive, non-productive political fight, I would say, with our leaders, who we're going to need today, tomorrow, and in the future. Additionally, this is, I believe, a waste if we do have the lawsuit, which is in the context here. It says it's a demand. If you don't do X, and I believe if you read it, the last whereas is contradictory to Section 3, which says look up for options. I'll be more than happy to support this if we took out that last whereas, because at least it says come back the first, which is going to be going to be the first day of the month, which that's the timeline. We'll be back here, and we could vote if we wanted to sue the state or the governor. So it's really contradicting, and that lawsuit will also waste taxpayers' money, because as we're hearing, there's a lot of lawsuits going on. Actually, one who's a representative of Homer Glenn, which I know many of our board members know, from who's on the Will County Board. We could use their quote-unquote benefits if they do win those lawsuits without using our resources. We just talked about how, $4.5 million we're going to possibly lose because of this. Why do we want to waste our money with more litigation? Rather than threatening our legislators or people in Springfield, I believe that we should do constructive criticism solutions. The IML, they have said, let's do the regions. I agree, we should talk about the regions, the 12. They also think that it should be a 14-day until the 14-day. Those are productive reasons. If we had a resolution to say, please pass what our governing board, the IML, talks about, which is the Illinois Municipal League, I would support that. That's what we're supposed to do. I believe that working with people and not causing controversy is more productive. And in my belief, this is not a productive resolution. This is not good government. I'm not sure where it is, but it's not for the best of our residents. These type of resolutions have negative effect for Village of Orland Park residents and our businesses. Thank you.
Mr. Mayor,
Trustee Katsinas.
Trustee Calangello, in all due respect, are we just supposed to sit and do nothing and be nice? Where has that gotten us? Where has that gotten our businesses? We agree on this board. We want to help our businesses, our small businesses. This is a step in the right direction. Sometimes the nicety doesn't get you anywhere. I mean, you have little kids, be real nice, and sometimes you don't get the action you're wanting to get. So you have to have teeth in it. I like the fact that this has teeth in it. This shows our residents that we as a board, as a community, are fighting for them. You know, what have we got to lose in a sense? You don't send this out and, oh, please, Governor, open our businesses. It's not going to work. It's not going to work. We were elected here, I feel, to represent the people of Orland Park and to show our strengths and to hold our head high and have teeth behind what we're doing. This has teeth without a threat, and it helps our businesses, helps people, and unlike Springfield, we're here representing them. So I applaud the attorneys who made this and put this together. Thank you.
Anything
Mayor?
else? You've already had two bites at the apple here on the board floor.
I would just appeal that if a trustee names that calls out another trustee, they'll be able to rebut that conversation. But if that's the decision of you, that's your decision. So I believe if any one of us call each other out, we should be able to rebut that.
I believe you called all the board members out. So any other comments?
Those are just facts. Thank you.
Mr. Mayor? You've already had your two bites at the apple as well. Anything else? Okay, so I have some comments to make. So first off, to the comments that were made about taking chances. I'm not advocating you go out there and take chances. Okay, we have science out there. We have a measured approach. We're not just throwing everything to the wind. Go look at our reopening plan, our back to normal plan. It's very measured. It's very responsible, and it's much more detailed than what the state put out. And we've used a lot of different resources, including the states, to build it. So measured is really important. One of the things is that one of the comments that were made was that the rest of the board did not support small businesses. I will go back to our restaurant opening. Nabia came to us with a good idea. Not give everybody $100 and this is going to make it go away. Would have $100 2 months ago, would that have helped y'all, or 6 weeks ago, would that have helped y'all? How about the 50 grand in the pot? Because that's the only other ideas I heard. That wouldn't have done anything. We wanted actionable ideas, not something that makes you feel good, but something that actually gets something done. This gets something done. We've made plenty of actions that got something done. To the comment that these things don't have an impact, well, let's walk through a little of that. A letter was sent to the governor on April 10th. We asked him to open several businesses that we could safely reopen. There was a follow-up letter on that topic on April 17th. It took until May 1st, but everything we put in that letter was opened in some way on May 1st. On April 24th, we sent our plan to return to normal to the governor. It's my understanding from talking to other mayors in the state that at least one other city and county also sent plans. Then, at the last board meeting, 4 of the trustees sitting here, Trustee Fenton was absent, 4 of the trustees joined me in supporting a resolution that called for the legislature to return to session because they've been AWOL. The governor to share data and information that he is using, which he still has not, and the governor and the legislature to work together to provide guidance for returning to normal. We did get the governor's plan. The legislature, they told me yesterday on a phone call, they have not weighed in and are not planning to. So we did that. The next day, the governor came out with his plan. Was it because of the resolution? Maybe not. Was it because we sent a plan? Maybe. Maybe that had an impact. Certainly, other people sent stuff too. The point is, the legislature also came back to work. So these things are having an impact. They may not seem like they're having an impact, but I don't believe it's a coincidence that all of these things are still happening when we're asking and other towns are asking. This is why resolutions and letters, like the ones being passed tonight and sent by municipalities and counties all over the state, matter. That's the way that we can influence policy, to Trustee Dodge's point, at the state level. That's the way democracy works. It's made a difference, and it will continue to do so. As I spoke earlier, the governor has refused to release the data that he's using, and he has resorted to threats. Last week, he threatened municipalities that he would withhold federal funds that were designated to municipalities during the relief crisis. He threatened residents who go across state lines to shop. He threatened businesses with taking their licenses. And in the final act, well, not even the final act, then later in the week, he threatened law enforcement officials with consequences if they don't enforce his mandates, that he doesn't have the legal ability to require our law enforcement officials to do that. The legislature does. Then on Friday, to what Trustee Milani pointed out, the IDPH comes out with a ruling that makes it a misdemeanor up to 1 year in jail for certain businesses, spas and gyms, restaurants. What was the other one?
It was restaurants, salons, and gyms.
Restaurants, salons, and gyms. That 1 year in jail if they dare defy his orders. That's not legislating. And our legislature needs to be a check and balance on this. And they haven't been. They've been gone. That's exactly what we're asking for. We asked them to come back, and they came back. Now we're saying, hey, these are the things you need to look at, because I already walked everyone through all of the metrics. We meet the governor's metrics. We're not asking for it. We're saying we meet your metrics. Let us open. The whole state's asking for that. We're asking the legislature to hold him accountable to what he said he would do. It's not a single person government. As we talked about, the state's failed us on a lot of levels. Half of the deaths in the state are due to long-term care facilities. As I mentioned, this resolution asks our staff to figure out what we can do, if anything, because we're not sure we can do anything, to help regulate our long-term care facilities into the future, because clearly the IDPH is failing at that. The state failed to provide a safety net for the unemployed 1099 workers, the 1099 workers, and the self-employed. We know the feds gave them money. They can't process the claims. They can't do the basic function of processing the claims, so we have people who are out of work that can't get money to feed themselves, to feed their families. They may get it 2 months from now, but that's not going to help them today. That's the state's job. They failed. As we talked about, the state failed to provide PPE for our first responders and our medical workers. We had to take care of this need with the Mask for Medical program. The governor's plan, as we talked about, ignores our most vulnerable yet again. The CDC and every expert plan recommends that vulnerable populations shelter in place and long-term care facilities do not allow visitors until we return completely to normal. This is very, very important. If the governor never changes his plan and never adapts it, I cannot emphasize that enough to our population to please heed those warnings. Trustee Fenton said it best. Trustee Dodge mentioned about how this is, about individual responsibility. For those of you who are over 60, immunocompromised, or you need to take care of yourself and you need to shelter in place until we get back to normal. The goalposts have kept moving. First, the goal was to ensure the healthcare system was not overwhelmed. We did it. We all worked together. All of us worked together, and we accomplished it. We reached that at the end of April. Then the stay-at-home order was extended to the end of May, and we were required to meet new metrics. The entire state, except for Chicago, met those metrics on May 1st. Now the entire state, including Chicago, meets those metrics. The legislature needs to convince the governor to allow us to move on to phase 3. Let's start returning that fourth leg. Let's start getting our economy moving again. To our point, the city of Chicago should be in its own region. We talk about that as well in this. The Restore Illinois goal also talks about having a vaccine, a treatment, or no new cases. That may be completely unrealistic, because a vaccine may not come, treatment may not come. It took us 40 or 50 years to come up with an effective treatment for the flu. Essentially, the governor wants eradication to move to the last phase. That's not feasible either. The legislature does need to address that. And I know the legislative body has told me, or the legislator told me, that they're not going to address this. They need to. They need to get involved. And we're asking them to do that. We're asking them to represent you and represent us. That's why we're doing this resolution. We're saying, please represent us. The IML, the city of Chicago, every other mayor I know of, except for one in Highland Park, agrees that 14 days is what this should be. Every expert. I would challenge the governor, please show us the expert that says it should be 28 days from one phase to another. I've sat in on a lot of these calls, talked to a lot of experts. The CDC recommends 14 days. Please, the legislature needs to address that. Lastly, there's no reason why restaurants can't be open in a limited capacity in phase 3. They won't survive, according to the governor's plan, until the end of June. We'll lose them. We need to open them. We can open them safely. Limited capacity, let the outdoor seating happen. This resolution asks the legislature to do this by the end of the month. We know we already meet the metrics. We meet the metrics today. We're not asking them to open us tomorrow. We're saying get this done by the end of the month and get us open. Or else we will consider our legal courses of action, because that's the right thing to do. And we were told that this would be a waste of money. How much money are we losing every month, Anne Marie?
A couple million.
How many?
A couple million?
A couple million every month. So if we open 1 month sooner because we go to court, it might cost us $100,000 in court, but it's going to get us $2 million in revenue. So it's money well spent. I don't want to do that. If I wanted to do that, we wouldn't have adjusted the resolution to what we did, and I think it was appropriate to adjust it. The legislature said they were coming back into session. So we are giving them time to do their job. But if they don't do their job, we need to take action for the people of Orland Park and for the businesses of Orland Park. We can do both. And in fact, it's imperative that we do both. If we don't open the economy, our healthcare system is going to collapse. It's already furloughing people. It's critical that we do both. We have to start doing this. We've seen other states do it. They've shown us the example for 3 weeks. It's time for us to do this. But do it in a measured and safe way. We're smart people. We can do that. The American people are wonderful people. They were already, before there was ever anything said about staying at home, movie theaters were selling half as many tickets. Restaurants were filling half as many seats, all on their own, without a government mandate. Amazing how that happens, because people care about people. The American people are incredibly compassionate. So with that, the original motion for the resolution, call the roll.
Trustee Katsinas.
Aye.
Trustee Malani.
Aye.
Trustee Fenton. Aye. Trustee Dodge.
Aye.
Trustee Calandrello. No. Trustee Healy.
Aye.
Mayor Pico.
Aye. Motion carries 6-1.
Treasurer Budget Office appointment, officer appointment.
Mr. Chairman,
Trustee Malani.
I move to advise and consent to the appointment by President Pico of Kevin Wachtel as Village Treasurer and Budget Officer.
Any questions or comments? Call the roll.
Trustee Malani.
Aye.
Trustee Calandrello.
Aye.
Trustee Fenton. Aye. Trustee Dodge.
Aye.
Trustee Healy.
Aye.
Trustee Katsinas.
Aye.
Mayor Pico.
Aye. Welcome aboard.
Ordinance amending Title 7, Chapter 9 of the Orland Park Village Code.
Ordinance number, please.
5514.
Mayor Peacock.
Trustee Dodge.
Move to approve ordinance 5514 entitled Ordinance Amending Title 7, Chapter 9, Orland Park Village Code.
Second.
Any questions or comments? Call the roll.
Trustee Dodge.
Aye.
Trustee Katsinas.
Aye.
Trustee Fenton. Trustee Calandrello.
Aye.
Trustee Healy?
Aye.
Trustee Malani?
Aye.
Mayor Pico?
Aye.
Comcast franchise agreement?
Mr. Chairman,
Trustee Malani.
I move to approve the franchise agreement and side letter between the Village of Orland Park and Comcast for a term of 10 years from the effective date unless the franchise is renewed or is lawfully terminated in accordance with the terms of this franchise agreement and/or applicable law.
Do we have a second?
Second.
Any questions or comments? Call the roll.
Trustee Malani?
Aye.
Trustee Dodge?
Aye.
Trustee Fenton?
Aye.
Trustee Calangelo?
Aye.
Trustee Healy?
Aye.
Trustee Katsinas?
Aye.
Mayor Pico?
Aye.
Maintenance equipment supplies, services, and inventory management solutions with Genuine Parts Company, Napa Integrated Business Solutions.
Trustee Malani.
Yeah. Resolution number, please?
2022. I'm sorry, 2023.
I move to approve Resolution 2023, entitled Approval of a Fleet-Related Maintenance Equipment Supplies, Services, and Inventory Management Solutions Contract with Genuine Parts Company / Napa Integrated Business Solutions.
Second.
Any questions or comments? My only comment is this is, I went through the numbers, save us what, about $200,000 a year we expect, and we have some of that written into the contract that's to be checked at 6 years, 6 months and 1 year to make sure that that is actually happening. So I think that's a great step in the right direction. Hopefully we can find some other nuggets like this. Call the roll.
Trustee Malani?
Aye.
Trustee Calangelo?
Aye.
Trustee Fenton?
Aye.
Trustee Dodge?
Aye.
Trustee Healy?
Aye.
Trustee Katsinas?
Aye.
Mayor Pico?
Aye. Motion carries.
Electrical Municipal Aggregation Program?
Mr. Chairman,
Trustee Healy.
I move to approve the electrical municipal aggregation program with the matching variable ComEd rate for a period of 12 months with Allego Energy for the supply of electric energy to the village residents pursuant to the village's electricity aggregation program, and authorize the village manager to negotiate the terms of a civic contribution on the village's behalf.
Second.
Any questions or comments? So what I'll say here is, for residents' purposes, we try to aggregate and get you the best price we could. ComEd's got the best price, but just like last time, we're going to use a company that has alternative sources of energy. And this year, they're going to, they have upped the ante, and they're going to actually contribute to the village, what, $106,000?
117.
170?
117.
117.
Yep.
117,000 that we're going to be able to use for LED lighting projects and other projects. So, so good work. Call the roll.
Trustee Healy?
Aye.
Trustee Malani?
Aye.
Trustee Fenton? Trustee Dodge?
Aye.
Trustee Calangelo?
Aye.
Trustee Katsinas?
Aye.
Mayor Pico?
Aye. So non-scheduled citizens and visitors, I think we have a lot of stuff to be written. You guys might want to.
Okay. We've got,
Mike's on.
Be reading these for up to 3 minutes each.
okay, our first comment is from Kim M. of Orland Park, Illinois. She says, as a resident of Orland Park, I just wanted to share that I would love to see Orland Park's small businesses open again with safety measures in place to protect against COVID-19. I am one of those unlucky residents that has medical issues, so I have to be very careful of where I go and what I'm doing because of COVID-19. Residents like me with medical issues know who we are and know what measures to take to protect ourselves. It is not right to keep all businesses closed and citizens sheltered in place. This will only destroy Orland Park's economy. I support Orland Park doing whatever is necessary to safely reopen our community businesses. This comment is from Jim Longino of LaGrange, Illinois. Orland Park trustees, I understand that tonight you are looking to circumvent protocols that have been in place and improved for over 100 years to protect the public in times of a pandemic outbreak. I cannot state more emphatically how shocking, detrimental, and irresponsible this action would be to your sworn duty to protect the residents and the broader community. The only people that need to be listened to right now are the health professionals working to prevent further deaths from this deadly new novel coronavirus, COVID-19. Respectfully, I wish elected officials would focus on helping people suffering right now instead of your mayor's corporate allies. The statements from your mayor regarding the veracity of the disease, as well as making this a political issue as opposed to a medical issue, is also appalling. I read your report, which looks only at economic demand, creation, and not loss of life. Using the libertarian-leaning, neoconservative, pro-business American Enterprise Institute and corporate stakeholders as references is not the same as using virologists and medical experts for public health. And now this evening, you have buried a resolution to sue the governor of our state to again put out an agenda against public health. What is your aim other than tying up the courts and your taxpayers' resources during a pandemic, where proven case law sides with the very things that protect the public health? It is very telling that your board would even consider this tactic, trying to stop protocols that protect workers and residents. If your businesses had an outbreak of rats, your own public health department and the state would easily shut down these locations until the problem was mitigated. How then is it even logical with an active pandemic level deadly virus, your mayor and members of this council somehow decide to ignore your oath and epidemiologists' expertise to protect workers, residents, and visitors? As a resident in another village, your village, by incurring this false choice over public health, endangers any person that comes in contact with someone who may have decided that needing shoes and shopping without a mask is more important than containing a highly contagious virus with deadly results.
Time.
The next comment is from Mary Ann Quinlan of Western Springs, Illinois. For all its concern about economic emergency, the Village of Orland Park summary resolution lacks awareness that folks are going through other emergencies too, on an unprecedented scale. Self-regulating individuals and businesses is a pipe dream in a pandemic. The village must minimize confusion and ambiguity, just as it expects the state to do the same. Specifically, the village needs to do two things: mesh its plan into the state's wording and timing, and stop looking away when person-to-person differences inevitably surface about distancing and wearing PPE as reopening proceeds. Focus more on a safe, orderly, and sustainable reopening, and less on partisan politicking. Here is what I am talking about. Social distancing and PPE are currently the most practical and effective methods people have to protect themselves, their families, and our community from COVID-19, which is a serious, even deadly disease. The mayor has stated that he does not believe that it is constitutional for the governor to require cloth face coverings to be worn in public at close distances. Some members of the public agree with the mayor's position. Some members of the public do not agree with the mayor's position for reasons that include their own health and the health of other family members.
1 minute.
Now is a time in which various members of the community are already feeling restless, anxious, afraid, or even feeling grief and desperation. This political dispute between the mayor's position and the governor's position on this and other COVID things is confusing to the public and could contribute to a sense of unease. Per the summary resolution, the village is relying entirely on self-regulation by businesses and individuals for distancing and PPE. However, persons can only self-regulate themselves and not others. Persons can ask or remind others to distance or wear face coverings. Elsewhere, dangerous altercations between workers and the members of the public stemming from PPE.
Time.
The next comment is from Jan Pitzrak of Palos Heights, Illinois. Good afternoon. I am a resident of Palos Heights, one town over from Orland. I am distressed over your rush to open. People from my town and yours interact often. And if you create little clusters of COVID-19 among shoppers and diners, you put residents of Palos Heights, myself included, at greater risk. Also consider this: if Orland is open ahead of others, it becomes a magnet for people from all around the area, both city and suburbs. It will surely include the less responsible ones, those less likely to observe stay at home, less likely to wear a mask in public, to social distance properly, and so on. So not only will they be bringing their exposure in Orland Park to their homes, they will bring their own exposures to Orland. Good luck with that. Bottom line, our state is already on a path to reopening, a slow but measured path. Daily death tolls are finally diminishing, a sign the plan is working. Don't jump the gun, don't mess it up now. That doesn't gain a thing unless, of course, the goal is to score political points. The pandemic should be bigger than the parties, and your mayor should back off and follow the recommendations of the public health professionals. Final note, if you proceed, I will not shop Orland now or later after the pandemic has passed. I will encourage all within my circles to do the same. Jan, 25-year resident of Palos Heights. The next comment is from Mary Beth Neziel. No address is given. Please follow the guidelines set up by Governor Pritzker. These guidelines were set up with scientific recommendations. Our freedom to live a healthy life is endangered with early openings. Early opening will guide my choices of where I choose to shop in the future. I can spend my money in other locations now and in the future. Thank you for your consideration, Mary Beth. The next comment is from Nick Unajewski. I don't see an address. Hello. I'm quite disappointed in the actions of our village board as we all collectively are getting through this COVID-19 pandemic. Instead of prioritizing public health, keeping our residents safe, uplifting small business owners, and protecting all workers, Mayor Peacock and the entire village board seems focused on one thing and one thing alone, and that is corporate profits. In the village's own plan, which is set on accelerating getting us back to normal and skirting the recommendations of Governor Pritzker, the mayor blames people seeking unemployment insurance from overwhelming the system. It is quite clear that the village board does not and seemingly never will, stand with workers. This village board has a long track record of siding with big corporations and ignoring the concerns of working families in Orland Park. By refusing to raise the minimum wage and opting out of earned sick time in 2017, working hard to weaken the unions in the village, and most recently suing a church to close a shelter for people in need, Mayor Pecaw's voting record is quite clear and where he stands on working families. Now, the mayor is set on including Orland Square Mall as part of his first phase in getting back to normal. Despite concerns about congregating and crowd size from the governor, he doesn't care about workers as long as it gets his corporate donors the profits they want. I understand the village's concern about sales tax revenue and the budget shortfalls they will face. What I don't understand is the clear omission in the plan of nurses who are working 12-hour shifts, our grocery store workers who have been working for 2 months to get us food and supplies we need, and our small businesses who need more immediate relief than being able to set up tables in their parking lots. There is no compassion in any of the village's communications in the last 2 months, only concerns about money. As elected officials, I expect more from all of you on this village board, and especially the mayor. The policies you create should be improving people's lives, not endangering public health. Stop your political bickering with Governor Pritzker and think of the nearly 60,000 Orland Park residents you are elected to represent. The next message is from Jeanette Quirk. I don't see an address. Dear Orland Park Village Board, I am writing to express my incredible concern over Mayor Pecaw's determination to back the Orland Park Mall Holding Company in their proposal to return to business as usual. I am a local educator, and it has been heartbreaking to conduct remote learning with families who long to return to school in the fall and who fear that the spread of the virus will delay school's opening. And not just school, but the sporting activities, relationships, resources for food and transport that schools provide. The behavior of Orland Park as a board goes against the recommendations of disease experts. Encouraging the return to business at such a pace as the mall could easily provoke disease outbreaks, not just in Orland, but in surrounding communities where shoppers come from. The increased chance of spreading the disease in a hasty return to business, and I have difficulty believing that social distancing and masking will be required, followed, or funded, increases the likelihood of disease spread and the unlikelihood of a timely return to school in the fall. Kids out of school means more parents can't work and then they can't shop. Kids out of school means the economy can't recover. Suing the state is a waste of taxpayer money. Please come to your senses, be a real leader, put health over profits in the short term, and it will pay off in the long term. Sincerely concerned educator. The next message is from Brianne Bazzetti. No address. We need to protect Orland Park workers and put people's lives first. Ignoring the governor's public health guidelines will only give Orland Park a step back, not forward. The next message is from Jenna Ligdis of Orland Park. As a citizen of Orland Park and an Orland Mall employee, I am extremely concerned and disappointed with Mayor Pecaw's recent actions regarding the COVID-19 pandemic. Time and time again, Pecaw has shown little concern for the citizens of Orland Park, and his current actions prove once again that he only cares about corporations and profits. By ignoring Governor Pritzker's pandemic guidelines, Pecaw is simply endangering Orland citizens. Without following the guidelines, Pecaw is guaranteeing an increase in COVID-19 cases throughout Orland Park and the surrounding areas. With no comments on how to protect citizens and workers, PCAW is providing that he only cares about money, not the well-being of the people that call Orland Park home. Non-essential businesses can wait. The health and safety of the population cannot. The next message is from Moira Kelly of Orland Park. My name is Moira Kelly, and my family has been living in Orland Park since it was just farms and a general store. I am the third generation of my mom and dad's side to live in Orland. My family was raised at St. Michael's, attended Carl Sandburg, and continue to live in a place they grew up. I love Orland Park and its community of kind and caring people. My parents are the most kind and caring of them all, especially now as they are essential workers. My mom, Margaret, is an occupational therapist at Smith Crossing in Orland Park, and my dad, Marty, is a construction worker in the city. I think about them and their safety every single day. So when my mom tested positive for COVID-19, I was terrified. The scariest part was I knew my mom wore full PPE to work each day, and she was still able to get sick. Thankfully, my mother has fully recovered and is back to work, but no one should be working unless they have the protective gear and paid sick leave they need. We must give our workers and citizens everything they need to be well by expanding testing and enforcing social distancing. When I heard about Orland Park's continuation of summer events, I was shocked. Mayor Pecaw's decision to forego social distancing altogether shows he does not care about the health and safety of our community, but rather keeping his corporate donors happy. Orland Park needs to put workers and people first by expanding testing.
1 minute.
And paid time off for everyone so we can control the spread of the virus. Our energy should be put toward helping our essential workers instead of gaining profit. Put essential workers first, Moira Kelly.
To the board of Orland Park, this is irresponsible and too soon. Please address how, when, where, and the necessary PPE and testing will be provided, assisted by the village to get these resources into the hands of all Orland businesses, not just corporate when they open. Without these precautions in place, workers, customers, and their exposed families are not safe. Furthermore, I don't want essential businesses like my grocery store or healthcare facilities having less access to these resources because people want to buy running shoes or dine out and now have resources are needed by shoe stores or the Cheesecake Factory. Non-essential businesses can wait a little longer for the health of our community at large, and let's keep our tax money here to go towards helping our villagers and small businesses during these stressful times rather than waste it suing the state. Megan McKenty. Dear Orland Park board members, I am emailing you asking you to consider your vote for the future status of the Orland Park Mall. I have lived in Orland Park for the last 22 years, my entire life, and my parents have lived here for over 30 years. I attended Carl Sandburg High School and have worked at numerous stores in the village. I am concerned for the safety of workers and public health. Should the Orland Park Mall open sooner than necessary? The Orland Park Mall, while a large contributor to Orland Park tax dollars, brings many people from surrounding communities. With so many people coming together from so many areas, I am concerned for the safety and welfare of workers and communities. Studies have shown that proper social distancing has worked to reduce the spread of the virus and amount of positive cases. Should we reduce these very important safety measures, our hospital system will not be able to properly treat those who need help. In casting your vote today, I ask you to please consider the opinions and measures to protect the lives of my neighbors and friends and whether or not short-term economic benefit is more important than long-term public health. Thank you, Sarah, Wheeler Drive resident. Dear Orland Park board members, I am a longtime Orland Park resident. I have lived in Orland Park for over 20 years. I graduated from Carl Sandburg High School. I have worked in various businesses in Orland Park as well as shopped at many local businesses throughout my time here. I know that this pandemic has been hard for people with so many out of work and unable to predict their next move. We need to look to scientists and public health officials to follow the math when it comes to restarting normal life. We should not look at political differences on personal egos when considering the safety of our town. I want public health experts deciding what's safe for our town and state in order to prevent overcapacity at local area hospitals. We are not an isolated town. If you look at the Orland Park demographics, we are a commuter suburb that is highly mobile. Just look at all 6 lanes of LaGrange Road. If we open up before guidelines are met, we risk the health and safety of not only Orland lives, but the lives of all Southside neighbors who come to Orland to shop, eat, and work. The common defense of supporting the stupid plan to forego social distancing is the state of the town's finances. I would not be able to justify the value of a person's health for a balanced book. People will shop here again, and revenue will rebound, albeit not immediately. When voting tonight, look at the people who call this town home and realize that their health is more valuable than the municipal tax revenue. Sincerely, Hannah from Silver Lake.
The next comment is from Kristen Hawksworth of Orland Park, Illinois. Dear Mayor Pecaw and the trustees of Orland Park, I just read in the patch that you intend to vote tonight to seek legal action against the state of Illinois if business and civil life is not allowed to reopen by June 1st. As a voter and a resident of Orland Park, I want to state that I am against this action. In the utter absence of federal leadership, Governor Pritzker has stepped up and has made difficult and unpopular decisions to protect the citizens of Illinois. Governor Pritzker has not created an economic emergency. COVID-19 and lack of both preparedness and an adequate social safety net have. The lawsuit is not only frivolous and I believe politically motivated, but will cost both the Village of Orland Park and the state of Illinois precious money and time when both should be focused elsewhere. Wording from Section 3 of your resolution states that the village is looking to the state to provide for the reopening of businesses and civic life with reasonable and specifically targeted public health guidelines or otherwise act to address the COVID-19 pandemic, which they clearly are, not just as the village would prefer. Mayor Pecaw has indicated that the village will not enforce the wearing of face masks and other requirements set in place for Phase 3 of the state plan, rather trusting in voluntary social distancing, a concept that is already proving to be flawed. You are the leaders, you set the tone, and the tone you are currently setting is one of childlike defiance. We all want to go back to some semblance of normal, but let's get there by working together, not against each other. Shame on all of you for this grandstanding, for putting money and politics over the health and safety of people you serve. Please rethink this move. Thank you, Kristen Hawksworth. The next message is from Michelle Nicolai of the LaGrange Highlands. I live in LaGrange Highlands, and Orland Square Mall is one place I frequented before virus emergency. Social distancing and wearing masks in public places is a must before I would venture into any public place. Retail workers would be a prime concern for me. In any group, there are those who are above the law, and this would be true for the general public that would be entering Orland Square Mall. This is a threat to retail workers inside the mall shops and to me. Unless there are guards legally entrusted with enforcing rules, I won't return to Orland Square Mall unless I get a vaccination for COVID-19 virus. This is a shame because I am one of the lucky ones not facing financial devastation. The next one is from Diane DeVito, no address. She has a couple of questions. What is the rationale behind the 28-day benchmark? And if we meet our criteria sooner, can we reopen sooner? The next is from a Mary Vogelsang of Orland Park. Orland Park has been my home for the past 35 years. I've raised my children here and lived nearly my entire adult life here. I have a vested interest in the well-being of the community. I urge you to vote down the resolution to grant the commencement of legal proceedings by the village attorney in the event that the General Assembly does not act to provide the reopening of businesses and civic life with reasonable and specifically targeted public health guidelines, or otherwise act to address the COVID-19 pandemic. I am disturbed by this body's efforts to speed up efforts to end the stay-at-home directive, and I thank Trustee Calandrello for his nay vote at the previous meeting. The Restore Illinois plan is rooted in science and designed to protect our community. Economic considerations must not override public health concerns. Reopening businesses prematurely will place employees at unnecessary risk. Today, more than ever, health is a public good. We must work together to protect each other. I implore you to redirect your efforts towards creating an infrastructure that allows people to stay at home safely as long as it is scientifically advisable. We can ensure that people's basic needs are met without sacrificing the well-being of those who will be most vulnerable. Mary Vogelsang. The next comment is from Amy Vogelsang, also of Orland Park, Illinois. Please vote no on tonight's resolution to urge the premature reopening of Orland Park's businesses with disregard for public health. Economic concerns are real and pressing, but addressing them must not come at the expense of our community's health. Such a decision will place workers in a position that forces them to relinquish safety to ensure economic security. Instead, we should be investing resources in strengthening unemployment protections, pushing for expanded access to COVID-19 testing, and implementing best practices to contain the spread of the virus. Workers' lives are worth more than their paychecks. I urge you to work with the state government in allowing science to guide our path forward, one that recognizes the value and dignity of all members of this community. Amy Vogelsang, Carl Sandburg High School, class of 2007. The next comment is from Holly Fingerl. No address. Dear Orland Park Board, your plan endangers public health. I found your plan to reopen to be centered on profits and revenues and not about the welfare of the public or your workers. None of the advisors listed were from nearby hospitals or public health organizations. The only advisors listed were those that are worried about profits and revenues. You are a regional shopping and entertainment magnet. You cannot reasonably use only your town's statistics. Who works and shops in Orland? It seems a waste of resources to sue the state when in a matter of weeks we are in target for the next phase of the governor's plan. Please reconsider. The next message is from Matt Tedeschi. No address listed. Mayor Peacock said the following in an online video. I cannot overemphasize the need for the vulnerable population to take personal responsibility for ensuring their own safety. A few points. Number one, Peacock is extremely tone deaf. He is peddling, bootstrapping, and an individualistic ethic of me that is both selfish and obvious. And a community leader should know that in a community we belong to one another and are responsible for and to one another. Let's all follow the sensible guidelines coming from Springfield so that we protect everyone and as much as possible together. Putting corporate profits before people's lives goes against everything this community should represent. Number two, Peacock claims he's a patriot who supports the Constitution, yet he also publicly degrades our governor, the General Assembly, and the IDPH every chance he gets, eroding our trust in government to make himself appear as the only competent leader. Peacock acts like he knows better than our state's leader and the top flight public health experts guiding him. Peacock's hubris is astounding. Instead of lining up for photo ops and TV interviews, sit down and listen to people who know better than you. Stay home and cover with a mask. The next message is from Kristen Salaba from Orland Park. I'm writing in today as a very concerned Orland Park citizen. I'd like to express my extreme dissatisfaction with the actions of our mayor and board of trustees. According to the Illinois Department of Public Health, as of 2 p.m. today, Orland Park has had 1,333 people tested for COVID-19 just within the 60462 zip code. Of those tested, 226 were positive. This is uncomfortably close to the IDPH's 20% threshold. To open up non-essential businesses in Orland Park in a more aggressive manner than is recommended by the IDPH and the plan put forth by the governor of Illinois is reckless and ill-advised. It is uncaring for the safety of Orland Park healthcare workers, retail workers, and shoppers, among others. I understand the need for many to get back to work to support themselves and/or their families. However, there are other solutions to support those who are struggling that do not involve putting them back to work prematurely and endangering their lives. People should have to choose between supporting themselves and putting themselves at risk. Furthermore, using village funds to sue the governor during a global and state crisis is selfish, irresponsible, and frankly unfathomable. I do not support it. The lack of compassion is staggering. Imagine if we used that same money, since it's obviously available, to support struggling Orland Park citizens so they don't have to work non-essential jobs until it is safer to do so. I will never support putting the village's economy over its citizens' health and well-being. You have my permission to read the comment. The next comment is from Barbara, no address listed. To whom it may concern, on the Orland Park Board, are you completely unaware of the seriousness of COVID-19? You must be, or you wouldn't be foolishly considering reopening the mall and stores and restaurants in Orland Park now. Are you aware that Cook County, Chicago, is the hottest spot for the virus today? You must not be, because if you were aware of that fact, you would be insisting that Orland Park should continue the status quo, and you would want to protect your residents and those who live nearby. If we could make sure that only you who support this action of early reopening and your residents who also support this reckless move would suffer from your stupidity, maybe it would be okay. However, that is not the case. Your childish attempt to gain attention with this political stunt will negatively impact the already overtaxed medical system and may also impact the health of the rest of us. All press is not good press. You should think beyond the contents of your wallet. The next comment is from Lori, no address. As I have stated to the mayor, I do not want Orland Park to open until the governor says it's safe. Do not waste tax dollars on this. The next comment is from Ken Hermanson, no town listed. I do not want to see our town opening up. The governor's plan has my backing, people and residents first. I will continue to support our local restaurants and businesses electronically on a regular basis. It's not that hard. Safety first. This is not political. It's practical. The next comment is from Tammy Giorgio, no town listed. Please talk about the workers who are employed in Orland Park restaurants and retail stores. What can you do to protect these essential workers? Will there be PPE, paid sick time, health care? What will the village do to protect workers who are the most vulnerable? This next message is from Abby McKinty, no address listed, to the Board of Orland Park. This is irresponsible and too soon. Please address how, where, when the necessary PPE and testing will be provided, assisted by the village to get these resources into the hands of all Orland Park businesses, not just corporate, when they open. Without these precautions in place, workers, customers, and their exposed families are not safe. Furthermore, I do not want essential businesses like my grocery store or healthcare facilities having less access to these resources because people want to buy running shoes or dine out now that those resources are needed by stores or the Cheesecake Factory. Non-essential businesses can wait a little longer for the health of our community at large. And let's keep our tax money here to go towards helping our villagers and small businesses during these stressful times rather than waste it suing the state. This next message is from Mary Quinlan. I don't see, oh, I may have read this one already, Western Springs, Illinois. Yes, this is a repeat. The next comment is from Carolyn Bonastali. No address listed. Hello, I am very disturbed that Orland Park is considering opening up their mall without regard for the health and safety of the community. What are you doing to protect the workers? Please reconsider. Next message is from Donald Wagner. No address. I am looking at the states where virus deaths are on the rise, and they are all the states that are opening early. Please, my wife and I are in our 70s, but we want to be safe in Orland Park, not sorry. The scientific data says that we will pay a price in COVID-19 cases and deaths if we open. Please hold off and study this more carefully. We would rather live than shop, and we need your leadership to keep us safe. People will not wear masks and keep social distancing as we are seeing around the country. Please put lives ahead of the economy. By following this simple wisdom, you will avoid an economic collapse when the virus comes around again. Thank you. Don Wagner. The next message is from Rosemarie Calasino. No address listed. I am part of Indivisible and have roots in Orland Park since the late 70s. My family and I, as well as the advocates from Indivisibles, strongly disagree with your decision to not follow science but corporate interests during this historic time. We plead with you to place the lives of the citizens of this village first. My mom is elderly and my father-in-law is in assisted living. It is my understanding that the 300 deaths from COVID come from long-term health care facilities. My nieces go to an Orland Park school. Do not put their lives at risk. There has not been a 14-day downward trend in COVID cases. Why are you even considering suing Governor Pritzker? You can learn from his leadership. Follow the science as he is. We support the health and safety of small businesses. We support the health and safety of our family, friends, neighbors, and colleagues. You must act in the best interest of your constituents, not your funders. We are watching and plead that you and the board make the right decision. Put the people first. Rose Calasino. The last comment is from Linda Khatib. No address. Healthcare providers must follow federal safety guidelines to guard against contagion, but other businesses are not obligated to do so. That means it's up to the states and localities like Orland Park to set standards, experts say. Watching death rates rise across the country from premature openings does not inspire confidence. Please protect the health and lives of Orland Park residents and those who come to Orland to shop and seek entertainment. Linda Khatib. So.
Thank you for all of that. Board comments, Trustee Fenton. Trustee Fenton. Trustee Dodge.
Just a couple of comments.
Okay,
Kat.
Trustee Fenton.
I'd like to thank all staff and so many residents that supported me during my in and out of the hospital. It was an intense experience for not only myself but my family. Since everything was on lockdown at my hospital, just like it is at every other hospital. And all of the good thoughts and prayers that came from staff and from all the residents. I know how all of us get through that, and I am truly grateful for that. I
Trustee Dodge.
Just a couple of comments, Mayor Peacock. So Kathy, glad you are back home. I know it was kind of a long adventure you didn't want, so glad you're back and on the mend. And for all the folks who wrote in and who contacted us in other means, appreciate the fact that we all have the right to speak our mind and to be heard, and you've been heard. As Kathy said, there's a lot of information out there. The science of pandemics has generally been known for a long time. The science of this particular pandemic is becoming clearer with each day, and I think it's going to follow the trajectory of prior pandemics, and we will all get through this. So to all the folks who said, let's pay attention to the science, let's be concerned for folks' health first and then livelihoods, we all agree. We all emphatically, clearly agree. And since we are a vibrant, healthy democracy, we can have differences of opinion. And I can assure you from a wee bit of land navigation training in the United States Army, every mountaintop has 360 degrees of approach. Some are harder than others. So let's keep working to find exactly the right one. And one last closing quote. We all talked about this earlier. I think some of you will recognize this, because I think we all need to get back to this as Americans and Illinoisans. One nation under God, indivisible, with liberty and justice for all. Thank you, Mayor Pico.
Thanks, Trustee Dodge. Trustee Calendar.
That's hard to follow that one, Jim. Thanks. Just want to thank everyone for the comments. I heard there was 30 comments. Thank you for reading them. If everyone heard all of them, we had more than 13 residents, and of those residents, 12 of them supported the action the governor or was concerned about opening up, and one was not. So there was one comment about opening up, 27 comments about concern, and 2 comments that were neutral, had questions in nature. So I'm glad we all listened to the comments, that we all were paying attention during it, and that we were being considered of most of our constituents. And also want to say thank you for a spirited discussion on the resolution. I know that we all worked, and I know that I worked my comments through some of the trustees, that we almost got to yes, but we just weren't there. So I appreciate the respectful conversation regarding the resolutions. And then finally, of course, Kathy, welcome back. I'm glad everything is going well, and so I'm glad that my prayers were answered. So thanks, Kathy, for coming back. We missed you. And on a final, I just want to thank all of our first responders, the police department, the fire department, the doctors, the nurses. As someone that has a family member who works in the hospital, this is a very big concern, Corona, and the issues with it. So all those I just mentioned are heroes. Be strong, and we'll all get through this together. Thank you.
Trustee Healy.
I would say exercise common sense. Exercise your liberties. Take advantage of them. Do not be intimidated by anybody or anything. Have some courage. That's in our genes, and we'll get through this. Thanks.
Trustee Katsinas.
Thank you. First of all, Kathy, I'm glad you're doing better, and look forward to seeing you here. It's lonely being the only woman up here, so I look forward to you coming back. Also, we've had issues with Comcast on the northwest side of town as well. So I know some in my neighborhood on that corner sector, it was a problem connecting. I concur with Trustee Fenton in the health and safety and welfare of our residents is paramount to everything we do. However, I did recognize a couple of names on the comments that were either from social media posts or that attended prior board meetings. Several of these folks lived out of town, and they are activists who routinely have attacked Orland Park's decision in the past. Before it was a homeless shelter, where we were attacked for upholding life and safety issues, dealing with laws and our ordinances. So I support everyone's right to be heard, but speaking for myself, I was elected by the people of Orland Park to do what's right for the residents, and the taxpayers of Orland Park. Thank you.
Trustee Malani.
Thank you. Tonight, once again, we've showed that good things can happen in Orland Park when we're in a pandemic situation. A lot of things went unnoticed. We recommended and approved our schedule of fall recreation events. We contracted to restore and maintain ponds in our subdivisions. We're building a new park. We're repairing tennis courts at other parks. And we make sure that our police department continue its great work with the mental health collaboration program. And on top of that, IDOT's going to be giving us money that we can use to continue our accelerated road improvement program. However, without taking a proactive approach to opening and recovering our economy, these good things are going to only be able to happen for so long. Orland Park has been doing an outstanding job, both staff and the trustees here, of maintaining the health, the prosperity, and safety of our residents. But without an economy that is flourishing, we can only provide so much. I look to a day soon where we can be back to normal, whatever that's going to look like. People's livelihoods, families, businesses, mental health, physical health, and their lives depend on it. And to address the notion that I would put money over the health and safety of our residents, a little bit about me. As everybody knows up here, I'm a member of our ESDO organization. I'm a member of New Lenox's Community Emergency Response Team. I've taken multiple courses provided by FEMA about pandemic influenzas, pandemic planning, emergency and disaster planning, and emergency and disaster response. I recently completed a 5-hour course provided by Johns Hopkins University by 5 epidemiologists, PhDs, and medical professionals about COVID-19, its implications, diagnosis, and how to effectively implement contact tracing. And I'm always constantly training on my own regarding to health, security, and safety. So to say that the health and safety of my constituents and the village of Orland Park is not my best interest, I take offense to that, and I hope you understand that the reason I'm here is for the health and safety and well-being of our residents. Thank you.
So my comments, thank you everyone for commenting. I would say it is important for people to fully inform themselves, and several of the comments they haven't read the plan. They're guessing what's in there. So I encourage people to go look at our plan, compare it to the Restore Illinois plan. You tell me which one's thorough and talks about all the details and all the things that need to be done. Our plan is data-driven. It was developed with a lot of experts, including health experts. The issue for us is we don't have a Department of Public Health, so we don't have doctors on staff that we can cite. And private doctors do not want their names put on those documents because then they open themselves up to massive medical malpractice suits. So we talked to a lot of health experts in the region to develop those plans, and I think that's pretty clear because if you look at our plan relative to Restore Illinois, it's actually more thorough, and look at it relative to other plans. So I think it's pretty clear that we didn't do this on our own, because had we wouldn't have a plan that was nearly as good. I can also say we have gotten zero guidance from the Cook County Public Health Department. I really would like to thank the city of Peoria and the Peoria Public Health Department for providing a lot of information here more recently. It gave us a lot of details and checklists. So they're actually out there doing their job, so we really appreciate that. Metrics have been set by the governor, as I showed earlier. We've met them, so has the entire state. I feel a little bit like we're Charlie Brown and Lucy's pulling the football out from in front of us. We go to kick it, and now it's moved. People can only take that for so long. We've had, first it was the health system, then it was these metrics. What's next? We can't keep having things moved. All we're asking for is that we're allowed to start safely reopening in a phased and controlled and measured manner. Anyone who accuses anyone on this board of not caring about the health and welfare and safety of this of our residents is it's absurd. It's an absurd comment. And I would say that even among the board members, some board members from the last board and this, that maybe I mostly disagree with on a lot of issues. I wouldn't say that any of them don't care about someone's health or safety or welfare. That's always paramount. Here's the hidden piece of information here. You can't have a good health care system without a vibrant economy. How does Medicare get funded? Payroll tax. Payroll taxes come from people working and paying and getting paid. That's where payroll comes from. Therefore, Medicare pays for that. That's the people who are over 65. You have to have a vibrant economy to fund these health care related issues. They are not mutually exclusive. In fact, not only are they not mutually exclusive, health and welfare is dependent on having a vibrant economy. It depends upon it, which is why it is so important that we figure out how we can open safely. Other states have done it. We actually have a plan here in Orland Park. The state has a plan. We're just asking to, since we've met the metrics, let's move forward with it and start and keep measuring the data, keep looking at it, because if you don't actually step into the water, you'll never swim. At some point, we have to step in, and we have to see what happens. And we've got good information from several other states that have stayed pretty flat through all of this. That's the data we need to use. It's not, these things are not exclusive from one another, and it can be done safely together. There's no question about that. We are smart people. We have a lot of smart people around. We can adjust, we can adapt, and we can find ways to do that. I can tell you, there isn't a business I talk to that don't want to keep their customers safe. So they're going to work as hard as anybody, trying to make sure that you're comfortable and that there aren't any issues. And I go back to the village of Orland Park. We have 20,000 people a day for 8 weeks going to Costco, Home Depot, Lowe's, Trader Joe's, Whole Foods, Mariano's, Jewel, et cetera, et cetera. 20,000 people a day. We've got one case tied to that. So if that can be done, that tells me that other things can start to open up safely too. Again, with common sense, good social distancing, we can do that. Kathy, happy to have you back. I'm glad you're feeling better. Hopefully you'll be able to join us at the next meeting, or at least the next one after that. I also want to thank some folks in our staff. Sam Brokop and Jason Zarena did a great job for Tierra Glen Homeowners Association Board. They sent a letter here thanking them for the efforts that they made. Also, I would like to I'd like to talk a little bit briefly about the flooding. We've had some. There's like one person out there spreading a whole bunch of false information about flooding in Orland Park over the last day, and I just want everyone to know where our flooding issues are. Actually, we got a ton of rain yesterday, and I saw water I hadn't seen before in the back of your yard. Your yard's actually designed so that when we have these rains, that's where the water stays, and then it flows and then it drains back out, and that's exactly what happened. So yes, I had a lake in the back of my yard for the first time ever, but then an hour after it stopped raining, it was gone. That's how that's supposed to work. We have some roads that we know we have issues with. Every one of those is a state road. Take that back. This time we did have one county road as well. But Southwest Highway between 131st and 135th. We know, the business owners know, they called me today to thank us because we have a plan in place. We got it pumped out. I think it's going to be good to go tomorrow, I think. That's because we put a plan in place. We got in touch with the Forest Reserve. They started draining the slough again, and so that could take some water on. So when normally we would have had maybe a 4, 5, 6 day flood event, this was 1 day. So we knew it wasn't going to eliminate it because there is a project to fix this road. It's on the books for next year. We're trying to push IDOT to start it faster. The COVID is not helping us start it faster. My guess is it won't start this year like we'd hoped. It'll probably start next year. But that will fix that problem. There's also Wolf Road. That also has an IDOT project that is just not funded. And if IDOT funds it, it will fix the problem. 143rd Street west of Wolf, same thing. IDOT Road. We have a project that'll fix it. Actually, that one's shovel ready and still not funded. So if we can get the funding for those projects, they'll get fixed, but they're not our roads. And then the last one was Will Cook Road from 159th to 151st Street. That's kind of a new problem, and actually it's because Cook County recently repaired some drainage, so they apparently didn't get it completely done. So this is a new issue we haven't had in the past. But it's the same roads that we've had in the past that have been a lingering problem, so there wasn't really anything new. There may have been some local areas here and there that I haven't heard about, but by and large, we handled it well. I know what I've heard. Since I've been back here, I haven't really seen a big flooding problem, but I'm guessing in the late 90s or early 2000s we had some flooding problems, but those have been addressed. They're not really an issue. They haven't been an issue for a long time. So unfortunately, we get big spring rains, we can have water issues. So just let us know if you're seeing a problem. We did have a backed up sewer yesterday, so we had to come out during the rain and fix that, because if you're seeing that problem, we will get out there and fix it because it's not normal. These other areas are somewhat normal. The last thing, we are obviously losing a lot of staff with the early retirement, so I really want to thank some of these longtime employees. They're great. Some of them are, they're all great people. Some of them I know pretty well. So as the month comes to an end, we're going to say goodbye to some of these people. So from our Parks and Grounds Department, Gary Couch is retiring. Gary and I go all the way back to playing softball together in like 98, 99, so I've known Gary for a long time. From the Recreation Department, Nancy Flores has been the Recreation Director for 13 years. She's also leaving us, so we'll be sorry to see her go. She's done a great job there. We put out a lot of wonderful events. From our Finance Department, we have Anne Marie Mampy, and I got that one right, Clerk Mahalik. And she's been the finance director for she's been here for 16 years and 9 months, so she does a great job with her finances, as you saw earlier today, so she'll be missed as well. And Sandra Petruka, payroll administrator of 21 years, is also leaving. Then we have Robin Wagner, a mechanic, 20 years and 4 months. And then David Rauch, maintenance worker in Public Works, 27 years and 6 months. And then Tom Morgan, our transportation operations manager, for 25 years and 11 months. And I have to say, Tom I've known since 2003. He runs the snow plowing contractor program, so I've known him since I was when I was first bought my business and was a contractor for him in 2003, so I've known Tom for a very long time. He's a fantastic guy, great worker, does a great job for us. He will be very, very sorely missed, and really enjoyed my time, not only as mayor for the last few years, but for the 14 years before that I knew him. He was just a fantastic guy that the contractors like. And I did miss one person, Bon Nola, maintenance worker as well, that we missed. So we're going to miss all those people. So thank them all. I want to thank you all for your service. And with that, I will take a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Aye. All opposed? We're adjourned.